Well, hey there, and welcome to the EcoCast by Actual Tech Media. Our topic today, Healthcare Health Check, assessing IT products and services to streamline healthcare operations. Now, improving and diversifying your organization's IT environment may be a process that you've already started, or maybe it's just on your to-do wish list. Whether you are looking to refine and improve existing systems or exploring whole new solutions, enhanced solutions in healthcare technology are becoming the norm and the expectation, both internally and externally. The opportunities are endless and they're really exciting, but also maybe a little bit overwhelming. So today we've gathered together an impressive collection of innovators and experts to review all the information that you need to assess and empower your healthcare tech tool chest. So get excited because today we will be hearing from the amazing humans from Progress Software, Zerto, Sophos, Rubrik, RingCentral, ClearData, and Nextiva. These experts are here in one place to help us explore exciting new tools to help you supercharge and streamline your organization's healthcare tech environment. Now, if you haven't joined us for an EcoCast in the past, a very special welcome to all the first timers out there. Actual Tech Media created the EcoCast and the MegaCast series to help educate IT professionals like you on the latest innovation and trends in enterprise technology. These webinars are designed to help you stay up to date and solve your most pressing technology challenges. But before we get into our sessions here today, there are a few things that you should know about this EcoCast. Now, of course, we do have some awesome prizes lined up for you, and I'm going to come back to those in just a moment. But first, I want to draw your attention over to the questions tab in your webinar control panel. So if you haven't already said hi, please do shoot us a message and a hello. Let us know how you're doing today. We love to see all of you connecting out there. Now, the questions console is also a great place to let us know about any technical issues that come up today. I do want to remind you all that a browser refresh is going to get rid of any of the usual tech gremlins, but if not, shoot us a message in that questions console and the Actual Tech Media team will be there to help. But most importantly, in that questions console, that's where we want you to put in all of your technical questions. That's going to make this the most informative and engaging style of webinar. So please do get those questions into us. Now, if we don't get to your question in one of our live sessions at the webinar today, because we'll be doing that after each presentation, but there's a lot of questions and not a lot of time. So if we don't get to your question, don't worry, because the awesome humans from Progress Software, Zerto, Sophos, Rubrik, RingCentral, ClearData, and Nextiva will be following up with you after we wrap. Now, okay, so we were looking at the questions tab. I do also want to point out that Twitter button on your console. Be sure to get social today and share with your friends when you have those cool aha moments. You can use the Twitter button right there in your audience console. The hashtag for today's webinar is automatically going to be added to your post. While you're exploring your console, we've looked at questions, we've looked at Twitter, head on over to that handouts tab. Make sure to click in, check that out. There are some incredible resources and takeaways from our speakers here today. Awesome collection of data sheets, some demos, white papers, solution briefs, and more. So click into that handouts section, start downloading, save those resources for later. Trust me, you are going to want them. Now, if we haven't met already, my name is Jess Steinbach with Actual Tech Media. I'm so excited to be your moderator for this EcoCast and join in this important conversation with you all today. A big shout out to David Davis and Scott Becker, who are also here with us. They're with us today on live chat, so make sure to say hi. And the good news just keeps coming, because on today's EcoCast, we will also be giving away 4 $500 Amazon gift cards to 4 lucky winners. Now, I do want to remind you that you must be in attendance during the live webinar to qualify for the prize and meet the Actual Tech Media prize terms and conditions, which you can find in that handouts tab that I just mentioned. Just click in, scroll down to the bottom, you'll find the full T's and C's there. Now, as I mentioned earlier, we absolutely love hearing all of your insightful questions during these live webinars. In fact, we love it so much, we have a special prize for all you inquisitive folks out there. So today in the EcoCast, we will be giving away a $50 Amazon gift card to the best question asked in each of our live sessions, each of our sessions. The teams are going to review all questions asked after the webinar, which means that even if we don't get to your question during the live event, there's still a chance that you will win that gift card. So make sure to get those questions in. I've put a few quick reminders up on the screen for you here, including the fact that all grand prize winners are required to submit an IRS Form W-9 to Actual Tech Media. Now, if you are a winner here today, you always have the option to donate the value of your prize to one of our selected charities. Thanks to generous prize winners on previous Actual Tech Media webinars, thousands of dollars have been donated to these wonderful charities. So if you are a winner today and you would like to get involved with one of these amazing organizations, please let us know. We would love to help make that happen. Now, we're excited to get to know all of you here today, and we want to keep that good feeling going. So be sure to connect with Actual Tech Media on Twitter and Facebook, and make sure to subscribe to us on the Actual Tech Media YouTube channel. Some fascinating on-demand webinars there, just about any topic that you can imagine. So be sure to go check that out. While you're exploring, we would also love to connect with you on LinkedIn, so be sure to find us there. And speaking of awesome content, if you haven't already checked out the Actual Tech Media Gorilla Guide Book Club, now's the time. The Gorilla Guide Book Club is going to give you access to free enterprise IT books. They're authored by top industry experts, so you get to stay up to date on trending enterprise technology. Now, I'm going to remind you that these books will work on your Kindle, your mobile device, and they are completely free, so it's just win-win across the board. You can download these exciting resources at gorilla.guide. There's actually a link for you in the handouts tab as well. One more exciting way to win a prize today is to refer an industry friend or coworker to the Actual Tech Media webinar series. You're going to find a link right there in your handouts tab, and you will be automatically redirected at the end of the webinar as well. We promise not to spam your friends. We send them one little email that gives them a list of upcoming events. If they don't respond, we get one little nudgy reminder, and that's it. Then both you and your coworker could win a $300 Amazon gift card. We hold those drawings every month, so make sure that you refer some friends, coworkers. It's pretty much a win-win situation. All right. Well, I've been talking really fast here because I am really trying to get us into our content. We have a lot to cover today. So I'm going to take a deep breath. Whew, okay, to kick us off, I am so excited to introduce our keynote speaker, who's going to give us some insight into some current key trends in healthcare IT. So today we will be hearing from Brian Posey. He is a 21 times Microsoft MVP, technology columnist, IT speaker, and analyst. And as you can see from his photo, a few other cool things as well, but I will let him tell you about that. Brian, thank you so much for being here with us today. We're so excited to have you here to kick off the EcoCast. So I will let you take it from here.
Hello, greetings, and welcome. I'm Brian Posey, and in this keynote address, I want to briefly talk about some of the current trends in healthcare IT. So before I get too far into the discussion, I want to give you just a little bit of information about me. I'm a 21-time Microsoft MVP, a best-selling technology author and speaker, and a commercial astronaut candidate, hence the spacesuit photo on the right. In addition to all of that, I am also a former healthcare CIO. Back in the late 90s, I was the CIO for a national chain of hospitals and healthcare facilities. Now, admittedly, that was a long time ago, but the reason why I wanted to mention that particular bit of information is because in the late 90s, the healthcare industry was undergoing tremendous transformation. That was the time when HIPAA was first coming onto the scene, and those of us working in healthcare IT were working really hard trying to figure out what the HIPAA laws meant for our IT infrastructure. Fast forward to today, and we're seeing similar transformation in healthcare IT, not because of new regulation, but because of new technology and new demands that are being made on practitioners. So that's what this keynote address is all about. I want to talk about some of the current trends in healthcare IT and how they affect us as IT professionals. Now, admittedly, there are numerous technology trends in healthcare IT. I could probably speak for multiple hours about all of the different trends that are taking hold. But without a doubt, the single biggest trend is the rise of telehealth. That's video conferencing between a patient and their practitioner. And this really started to gain traction at the time of the pandemic, because prior to the onset of the pandemic, the number of consultations between patients and their doctors that were done virtually over video conferencing software was about 0.1% of all consultations. And during the pandemic, that number increased, according to Forbes, to 43.5%. That's a huge increase. And the reasons for that increase are obvious. Everybody just felt that it was a lot safer to do their healthcare consultations virtually rather than going into the office. Now, having said that, there's really no reason to expect this trend to change. My guess is that telehealth will likely increase in its use because it benefits both patients and practitioners alike. Now, why is this? Well, from a patient perspective, telehealth is great. I mean, nobody wants to have to get dressed, go into a doctor's office, sit in a waiting room when they don't feel so great, never mind the possibility of catching an infectious disease from another patient while you're waiting. From a practitioner standpoint, telehealth has the benefit of allowing them to see more patients in a reduced amount of time. Not to mention, seeing patients virtually decreases the risk of spreading infectious diseases. So there are numerous benefits to the use of telehealth. But you also have to consider the idea that healthcare facilities have made significant investments in the infrastructure needed to provide these virtual patient visits. And these facilities aren't going to be anxious to abandon that investment simply because the situation with the pandemic has changed. They're going to want to keep using all of that infrastructure that they've already paid for. So telehealth is clearly here to stay. But my prediction is that we're actually going to see an increased use in telehealth going into the future rather than seeing telehealth use stabilize or even decline. While it does seem likely that we're going to see an increase in telehealth consultations between patients and doctors, that's not to say that telehealth is going to remain unchanged. Telehealth is likely going to evolve significantly. And as an example of the type of evolution that we're likely going to see, I would point to general video conferencing and the way that that has changed in recent years. If you think back to a few years ago, video conferencing was just that, video conferencing. It was a way that two people could communicate with each other, similar to a phone call, but with video. And in some cases, it wasn't just two people, it was a group of people, much like it is today with Zoom meetings or team meetings or what have you. Eventually, though, video conferencing was enhanced, and the experience became less about communication and more about collaboration. Because today's video conferencing platforms don't just let you see and speak to the person that you're communicating with. You can share your screen, and in some cases you can even open a document, and the participants on the call can simultaneously collaborate on that document, making changes to it in real time. Now, it's unlikely that a doctor and a patient will need to collaborate on a document in a telehealth conference, but I do see telehealth evolving in similar ways, meaning that additional data will be brought into the telehealth experience. So what we're probably going to see is an increased use in the integration of things like wearables, sensors, and even IoT devices. So that way, when a doctor has a telehealth session with a patient, they can look at the patient's data in real time. They might monitor the patient's pulse, respiration, blood oxygen saturation level, and things like that, and be able to see that information in real time as they're talking to the patient. Additionally, the patient may have other sensors that are surgically implanted, and the doctor will be able to monitor these as well. Another way that telehealth will likely evolve is that we'll see an increase in telehealth use in remote areas. Because right now there are some areas where it may be difficult for a patient to physically visit a doctor, and at the moment telehealth might be impractical in some of those areas. But as connectivity increases in remote areas, particularly as a result of 5G and similar technologies, we'll likely see telehealth come to those areas, making healthcare much more accessible for the people who live in remote areas. And we're not even necessarily talking about rural areas or areas that are cut off from the rest of the world. This could also pertain to places like undersea environments or even space. Another way that I conceivably see telehealth evolving is through the use of machine learning. Because if you've got patients that are using wearables to generate real-time health data, or they have surgically implanted sensors, or are making use of other IoT devices, all of those devices are generating data. And the next logical step for that data is to use machine learning to interpret the data. So a machine learning algorithm might pair a patient with the doctor who is best positioned to help that particular patient. That might be the patient's primary doctor, or the machine learning algorithm could realize that the data points to the need for a specialist and automatically connect that patient with the specialist who is in the best position to help them with their own unique healthcare needs. Going forward, machine learning will be used in other areas of healthcare as well. Machine learning could, for example, be used to better monitor high-risk patients remotely, or it could even improve the quality of life for the elderly. I'm sure we've all known elderly people who prefer to remain in their own home rather than going to an assisted living facility. And yet there's cause for concern in case that elderly person were to take a fall or something like that. Well, this is where machine learning could help, because right now there are smart cameras that have machine learning integrated into the cameras. Now, historically, these types of cameras have been used primarily for security purposes. For example, there are security cameras that can perform facial recognition based on machine learning chips that are built into the camera, so they don't have to consult an external database or anything like that. And there are other security applications for these types of cameras as well. But just imagine how a smart camera like that could be used to help the elderly. An elderly person might have several of these smart cameras in their home, and those smart cameras could be used to detect a fall. So if the camera senses that this person has fallen and that they have trouble getting back up, then it could be programmed to automatically contact the paramedics and get that elderly person the help that they need. So that's just one example of how machine learning could be used to help the elderly. Another way that machine learning is increasingly being used in healthcare IT is with the reading of radiology scans, things like MRI and CT scans. Because at least in some cases, a machine learning algorithm can detect things in an MRI scan or a CT scan that a human doctor might miss, simply because the doctor is fatigued or they're in a rush or something like that. So machine learning could make reading these types of radiology scans more accurate and reliable. And when you combine this machine learning technology with other technologies such as augmented reality or mixed reality, it opens the door for other possibilities as well. For example, it might make it possible to accurately diagnose complex conditions remotely. Let me give you a really personal example of this. A few years ago, I was involved in an experiment in which a doctor had created a portable radiology suite in the form of a virtual reality headset. Where I come into the picture is that myself and several others tested this particular headset in zero gravity on board a parabolic flight. The idea being that if there were a medical mishap in deep space, for example, on the way to Mars or something like that, then it might be possible for an astronaut on board the craft to don this mixed reality headset and perform a diagnosis of their crewmate using the logic that is built into the headset. Now, obviously, we're a long way off from being able to do that, but that points to where the IT industry and the healthcare industry are going regarding their use of technology in order to make it easier to diagnose conditions remotely. So with that said, I'm just about out of time, but I'd like to say thank you for listening to my keynote, and I hope you enjoy the rest of the event. Thanks again.
Okay, well, thank you, Brian, for kicking us off in style. That was such an awesome start to the EcoCast today. I love getting those hot trends and kind of what we need to have in mind. Now, if you're looking at your screen right now, which I hope you all are, you will see that we have put up a poll question for you. So this is your first test of the day. We're checking to see how alive, awake, alert, and enthusiastic you all are. Let us know if somebody asked you what you do, what your job is. Would you say I work in tech, as in I work in tech, or would you say I work in IT, as in I work in the IT department? Now, if obviously in this case, I think we're going to have a lot of various people coming from different teams and fields because we're looking at more of a healthcare approach, that's fine. Go ahead and write that into the other field. We'd love to know where you where do you self-identify on your career path, and let us know what that is. So either I work in tech, I work in IT, or I work in other. Let us know. Looks like we've got a large grouping of you in IT today, so lots of IT folks out in the audience. Okay, well, I'm going to keep moving things along. I have one more test for you this morning, and I promise we'll keep these tests to a minimum. But you guys all look like you've had your coffee this morning. I see lots of good answers coming in, lots of hellos and highs. So what we're wondering now is, what is your time frame for adding new or updating existing IT solutions at your company? What is the time frame? So obviously in this case, we're looking at kind of assessing some tools in your healthcare IT tool chest. When would you be looking to maybe upgrade or add new ones? What is that time frame? So I'm seeing a lot of results coming in that 6 to 12 months, which is pretty cool. But I have to say, it's actually pretty spread across the board here. You all seem to be pretty even, which is a really great place to start an EcoCast because it means that we have a lot of variety out there. Some of you may be just getting started to think about this, and some of you may be a little bit farther away from making any changes. And either way, you're going to get something out of the sessions today. So speaking of which, let's get started. I'm going to move us along in our EcoCast because it is my pleasure to introduce you all to our very first presenter. In today's EcoCast, we are definitely starting with a bang. David Perez, Senior Product Marketing Manager at Progress Software, is here with us. David, thank you so much for joining us. I know our audience is pumped and ready to get rolling on this EcoCast today. So without any further ado, I'm going to hand things on over to you.
Thanks for that introduction, and thank you for attending today. We're going to talk about Move It and the healthcare digital experience, and in particular, how Progress can help you deliver a secure, best-in-class patient experience. Now, we have a lot of items to cover today. just to give you an overview of where we're headed, we'll start with healthcare digital experience and what the big picture looks like. Touch on a few interesting developments that will give you a sense for where things are headed. We'll help you assess what's needed for your organization to deliver a healthcare digital experience in a way that is secure for you and all your stakeholders. Talk a little bit about what Progress is doing with the healthcare industry in general. And then we'll dive into managed file transfer, what it is, and what Progress offers in the way of managed file transfer, specifically our Move It product line. And then I'd like to walk you quickly through Move It and the patient journey, what part Move It would play in delivering secure interactions with providers from the moment that someone decides, hey, I really need to engage with my healthcare system, and then talk about next steps. With that, let's talk about Jeff Bezos. Some of my closest friends have referred to him as Bezos the Barbarian, taking over everywhere he goes, but clearly one of the great leaders in the industry where technology is concerned. But what about healthcare? When it comes to healthcare, recently, Amazon has decided to jump in and try to disrupt this vertical by starting to build and acquire offerings in that space. He's famous for saying, your margin is my opportunity. And in the past 2+ decades, we've certainly seen Amazon enter, for better or worse, its fair share of industry verticals. And Amazon has certainly begun entering the healthcare space. Back in 2018, Amazon acquired PillPack. Its focus is on the customer experience aligned with Amazon's obsession for customers and operational excellence. And most recently, Amazon acquired primary care provider, One Medical, for almost $4 billion. And their goal is to provide a seamless combination of in-person, digital, and virtual healthcare services that will no doubt eventually assimilate into the broader Amazon ecosystem. So there's a lot of attention on the healthcare vertical and how technology can help deliver really an elevated, compelling digital experience. Just to make this more real for us in whatever healthcare systems we're already taking part in or helping to deliver, 60% of patients are researching potential healthcare providers online before even booking with them. What do they value most? Well, at the top, information availability. They want ease of use when they're interacting with an app or a portal. They love mobile optimized technology, and a third of patients rely on online booking. So it's increasingly becoming a digital experience for patients when they interact with their healthcare providers and with systems. Now, when we surveyed healthcare professionals, what do we see? 50% plan to invest in technology to communicate with their patients through, well, text messages. And I think we've already had some taste of that, whether it's with, family or general practitioners, dentists, other medical specialists. Slightly fewer of these are engaging in automated engagement workflows. So appointment self-scheduling, referral management, pre-procedure communications. And that means that we've really turned the corner from this being a novelty to really going mainstream. So bringing this down to our organizations, how do we assess what sort of technology capabilities are needed to deliver a compelling healthcare digital experience? Well, we got to ask the right questions. First off, which tech will have the biggest positive impact on delivering this experience? We want to do things that will deliver not just great results, but obvious results that benefit stakeholders, and especially where patient interactions are concerned. We want to look at whether we build or buy. One of the oldest tech questions there is, what could you purchase so that your team can focus on what it does best? Obviously, every IT team has limits to what it can do in terms of resources and budget. So where do you put those resources? Typically, you put them into places where you can drive your organization's mission. And that means offloading tasks that are essential, but not at the core of what your IT team should be doing. So that leads us to the third question. Are there software and services that could give you improvements in operational efficiency that also meet fundamental needs, like improving security? Okay, and kind of tying this all together, could we address each of these areas of need all at once? What single purchase or purchases could optimize all of these available resources? So let's step back a moment, and I just want to share briefly how Progress is working with healthcare to transform healthcare organizations. Progress has a really strong track record supporting healthcare organizations all over the world, not just in the United States, with their digital transformation initiatives. And not just managed file transfer, but in many other areas, Progress provides a wide range of products and across a wide array of use cases. Our customers are using our technology for everything from decision services for diagnosis, nutrition plans, billing reimbursements, chatbot technology, and even more to provide a way for patients to interface for appointment scheduling, of course, web-based, personalized, mobile optimized patient and medical professional experiences. So we're deeply involved in healthcare across a wide range of functions, but specifically, I'd like to walk quickly through some of the Progress features that are most important. You can trust Move It because thousands of organizations worldwide are using it, not just in healthcare. It gives you full visibility of files, both at rest and in transit. And it encrypts these transfers, whether you're sending them internally or externally. You can deploy Move It automation to eliminate human error, improve operational efficiency, doing large scale transfers in an automated fashion without even programming. And that frees your IT team even further. Gives you centralized management so you can control these transfers from any device and helps you meet those essential cybersecurity standards like HIPAA, SOC 2, and so forth. Let me give you a quick rundown of how we offer Move It. There's Move It Transfer, standalone Windows Server application you can deploy on-prem or in the Azure cloud. There's Move It Cloud, which is Move It Transfer as a service. Progress hosts it for you. We manage everything and give you incredible scalability and ease of use. Move It Automation for automating large volumes of file transfers and setting up complex workflows. And if you need a secure gateway to separate access from the outside to your secure files within your firewall, we've got Move It Gateway, gives you a DMZ resident reverse proxy. And getting down to the nitty-gritty, what is it specifically that Move It offers to give you peace of mind? Well, of course, there's secure file transfer, automation I mentioned. There's a complete audit trail that is tamper evident. So not only do you know that your transfers are secure, you know and can prove it, and you can respond to audits with the audit trail that's created. As I mentioned, it's not EFSS, it's centralized, much more secure, and really essential for organizations that need to meet compliance like HIPAA and GDPR. We've got live view dashboards, ad hoc transfers made very easy through add-ins for our Microsoft Outlook. secure access control that is made even more secure through multi-factor authentication, password resets, sign-on acceptance, mobile application, deploy it and integrate it easily with REST and Java APIs. We offer automatic encryption key rotation, compatibility with AWS S3 endpoints, and this is an ongoing concern for progress. We do at least 2 releases per year on average, and we are far and away one of the leading managed file transfer products on the market. Now, enough about specific features. What about the benefits? MoveIt makes everything easy to deploy, use, and maintain. It offers you seamless collaboration for everyone in your organization. I mentioned the Outlook add-in. It gives you the interfaces you need to make secure, compliant transfers just intuitive and super easy. The compliance offers you peace of mind. Not only are you compliant, but you know that you're compliant and you can prove it. And again, it gives you more time for what matters. Put your IT team to work on things that matter more to your mission, so you can do the things your organization exists to accomplish. I mentioned briefly, MoveIt's the industry leader. How do we know this? Well, recently, MoveIt hit the leader spot once again in the G2 software reviews for managed file transfer. I'd encourage you to look at some of these reports and just see what people are saying about MoveIt. A lot of love out there, and we're especially proud to get these favorable ratings from people who actually use managed file transfer on a daily basis. Now, who's using MoveIt, and what kind of case studies are there that relate to healthcare? The first case study I'd like to bring your attention is with Milwaukee County. They centralized dozens of file transfer systems that they had throughout the organization onto Progress MoveIt. And the end result was phenomenal. Disparate FTP and data transfer systems were really keeping them from fulfilling their mission, delivering services to the public. Now there's no one on any of the teams that use MoveIt that has to manually transfer files or spend time writing the code to build an application to transfer files. So huge amounts of time saved. It supports mission critical data, makes it trackable and secure. They're worried about HIPAA regulations because part of the county function is to deliver public health services. And when I say extraordinary ease of use proved to be particularly valuable, it absolutely is the case, because one department started off using MoveIt in Milwaukee County, and as soon as other departments saw how easy and secure the transfers were compared to what they were doing, the use of MoveIt started to spread throughout the county and the benefits multiplied. So ease of use is absolutely phenomenal with MoveIt. Texas Children's Hospital. This is something you'll see a lot in a healthcare environment. An integrated delivery network or hospital network could have lots of partners, 70 plus hospitals and partners in this case. They decided to standardize on MoveIt and manage these tasks with automation and take advantage of the scalability and ease of access of the cloud. And they're meeting stringent HIPAA compliance requirements for all these transfers. And how many transfers are we talking about? 8 million plus patient records and credit card transactions. And they're also automatically extracting and routing personal health information from the Cerner health record system. So a lot of phenomenal things are happening here. And when it comes down to the bottom line, why would they care so much about using MoveIt for something like credit card transactions and patient records? It all has to do with speeding up the delivery of care and making sure that there's no interruptions to business, so they can focus on saving lives, improving health, and thinking less about managed file transfer. Last of all, I wanted to mention Rochester Regional Health. MoveIt helped them find a way to standardize their file transfers, centrally manage the tasks across 15,000 employees at 8 different locations. So it doesn't need to be, the biggest healthcare system to deliver these huge benefits. They're working across Epic, which is almost ubiquitous across a lot of healthcare systems, Workday, HR, and ADP payroll. So we're connecting a lot of systems in a secure way here. And again, meeting HIPAA and high-tech regulatory compliance. So the beauty of this particular deployment was that previously they didn't have a way to monitor or manage the multiple automated batch files, and now they're doing it centrally. So huge benefits for them as well. So I want to step back to the patient experience for a moment. I'm going to walk through this really quickly because there's just a ton of slides. But what we're going to do is start with this person, Rita. She just moves to town. She met up with an old friend. She asked her friend for a recommendation for a good doctor, as she is planning to expand her family soon. So there's all kinds of things that happened in this patient journey. Rita Googles Dr. Cannon, finds out he works at Quantum Clinic, clicks on an ad extension related to preconception counseling. And suddenly Progress can offer help here with Sitefinity, right? Are your campaigns resonating with the target audience? And you see how your traffic acquisition campaigns are performing. Here, we're really connecting patients with providers, and Progress is doing that through Sitefinity. So Moveit's not quite in the picture yet, but we know that the conversion rate is up because Sitefinity is helping to make those connections. Now, there's other steps that happen throughout this process. Rita arrives at the clinic's landing page, engages with a chatbot delivered through Progress native chat, right? And in the end, she receives a text message confirming your booking. Again, we go back to Sitefinity. And this whole experience becomes personalized. There's explicit, implicit, and connected personalization capabilities centrally managed. We're prioritizing user segmentation, which is important for healthcare delivery that focuses on particular need or audience. And this personalization is happening in minutes. So we began to optimize that personalization. We're measuring its effectiveness. And here I mentioned native chat for the chatbot experience. We're optimizing the workflow. It's really the first line of support. It's a way to serve customers 24/7, enhancing the patient experience. We continue on. I know this is going really fast, but I want you to see what's happening in this patient's journey with the first contact with this provider, right? Rita's on her way to the Quantum Clinic. Her appointment's with Dr. Cannon. Car suddenly gets a flat tire. Boom. That happens. Life happens. And while waiting for roadside assistance, she opens a text message she received from the clinic when she made her appointment and is able to reschedule as needed. On the day of the appointment, Rita arrives for registration. She's asked to register using her phone. And so here, there's personally identifiable information submitted through a form that probably connects with a health information system. And Sitefinity Forms helps deliver those, providing service hooks that easily integrate with systems of record. Now, there's also the need to share that information with partners in the healthcare ecosystem. So we'll keep that in the back of our mind as we progress here. After filing the registration, Rita has her consultation with the doctor. And at the end of the appointment, Rita is told she can access her personal file, dietary recommendations, checkups, suggestions, and so on through dedicated app. Go back to mobile app. And again, we're looking at beautiful, rich experience delivered mobily. Kendo UI is a product that helps to deliver that user interface with support for .NET, JavaScript. It's really making it easy for everyone across this ecosystem, and for Rita especially. Maybe Rita's saying, well, I need to make some choices here. When am I going to have follow-up appointments? Do I need to go get a prescription filled? Do I need to go talk with a specialist? Maybe get some exercise or physical therapy set up? Porticon will help set up business rules that puts people in the right flow for what their needs are, and really drives that patient experience that while meeting regulatory compliance and helping bottom line for the providers. Now, the initial consultation is just the start of the extended patient journey. I want you to think back to that moment where we were transferring personally identifiable information, okay? If it wasn't secure there and Ria's information was suddenly being sold on the dark web or being open to other patients, it would be a disaster. It would undermine the entire experience, and it could actually end up in liability for the providers, lost reputation, and just a lot of extra work that undermines the organization's goals for delivering a compelling digital experience for healthcare. And so in this context, MoveIt plays a critical, if less visible, role in creating that compelling digital healthcare experience that works for patients, providers, and everyone in between. If it's not secure, nothing else matters, and MoveIt delivers that piece of security that is absolutely vital to making this all work. Now, we've talked a lot about things at a high level, down to individual features of MoveIt, but I would really love to get a free trial, free demonstration of MoveIt into your hands so that you can see how easy it is to use and how it could deliver benefits for you and your organization. I invite you to connect with us for a free trial. Reach out to our sales team if you'd like to discuss your particular organization's needs and how we can help meet them. Or if you have a comment or question for me, please email me, david.perez@progress.com.
Oh man, David, thank you so much. What a great presentation, an awesome way to kick off the EcoCast. We have a lot of questions in a very short period of time, so we're going to jump right in, but I do want to point out very quickly that there is a poll up on the screen there. We really want to hear from you. What additional information would you like about the Progress Software Solution? So please take a minute right now and fill that out. This is a fantastic way to let the team know how they can support you, how they can help you wherever you're at in this conversation here. So do fill that poll out. David, are you ready to jump into some questions?
I'm ready.
All right, well, let's do this. Okay, we are going to start with this one here because I think we got a few questions about the how easy it is and the manpower required or human power required. So how many people does it take to manage an MFT application?
That's a great question, very practical. When it comes to Progress MoveIt, I would say once you've got it set up properly, it really only takes one person to manage it ongoing. But it's a security best practice to have people take their vacation, like make them take their vacation so that other members of the IT staff can rotate in and see how things operate, see how to maintain it, update it, keep it upgraded. And so really it's quite simple to manage. With the help of the Progress team, you could easily get this set up in your organization within a day. And so as far as people power, it's going to be relatively minimal. You would still want 2 or 3 people who can help fill in the rotation ongoing.
Perfect. Nice and easy. We started this EcoCast today with a little chat about what's trending in healthcare IT. And we did get a question if you can address what trends are you seeing in cloud deployments?
Public cloud is awesome. It's really big. It's been big for a long time. And I think even organizations that have been hesitant to leverage public cloud services are finding that they're making the leap and they're starting to do hybrid deployments. And so they're offloading some of their workloads to the public cloud, but still maintaining their own data centers or even their own organizational cloud. But we're going to continue to see people making use of that public cloud, and so developing their own hybrid approach to cloud deployment, and that includes working with an MFT solution in a hybrid fashion.
Awesome. That's going to be cool to see. Keep your eyes on that trend. And we obviously have a lot more questions coming in that we are not going to get to today, but I do want to assure everybody out there that we're going to make sure that Progress gets all the questions asked, so David and the team will be able to follow up with you. David, before you leave us today, you mentioned the free trial. I want to hit that again. Is that the best way for somebody to get started if they're interested in exploring Progress? Is there anything else that you would recommend that they do?
Absolutely. So the free trial, it's a 30-day free trial, and you can really get hands-on with it and see all the benefits up close. If you want to just talk with a member of our sales team, they're very sensitive to, the value of your time and also, what your particular needs are. And, they're just great to talk with. That might be a good first step if you're not sure exactly where to begin and you don't even want to invest the time into a trial, and they can just help you see where there could be benefits for you and your organization.
Perfect. I love that. Okay, well, some great ways to get started. I can definitely attest the team is awesome to speak with. And David, always a pleasure. Thank you so much for joining us here today.
Thank you. Have a great day.
All right, well, and if you're looking for more information right away, I'm going to recommend that you head on over to that handouts tab. If you haven't already done so, click on the Progress link. There's some easy way to access that free trial there, so you can really dig in and start exploring the solution. As we all know, those demos and free trials are really the best way to see if something's really going to fit for you. So with that, we're going to keep zipping along in the EcoCast because we have a lot of great information to get to today. Thanks to everyone who took a moment to fill out that poll. Up next, I am so excited to introduce you to our next two awesome presenters on the EcoCast, Mike Nassas, Product Marketing Manager at Zerto, and Anthony Dutra, Technical Marketing Engineer at Zerto. Mike and Anthony, thank you both for being here with us today. Mike, I think you're going to get us started, and Anthony will join us a little bit later for some Q&A. So Mike, the platform is all yours.
Sounds good. Thank you. Sounds good. Thank you. Sounds good. Thank you. Sounds good.
Oh.
Can you guys hear me okay?
Infinite sound loop. Yeah, we gotcha.
Okay, great. So good afternoon, everyone. Sorry about that. My name is Mike Nassas, and I'd like to take the next 15 to 20 minutes to talk to you about how Zerto can help you achieve and deliver uninterrupted healthcare, and why organizations just like yours really trust Zerto with their most critical of digital assets. So across healthcare, digital disruption is really taking hold, as evident by the proliferation of telehealth, AI, mobile health apps, wearable devices, and more, right? Virtual care is becoming a mainstay in many health systems. With this comes a huge amount of data that needs to be protected. And as a result, the healthcare industry has become an attractive target for cyber attacks in recent years. Protecting patient data while simultaneously improving care and ensuring continuous availability is critical for organizations in this space. When we talk to our healthcare customers, there are really three challenges that are top of mind. The first challenge is the continued and growing threat of ransomware, which has become a C-level priority for all organizations we speak to. Unfortunately, it's really no longer a niche threat, and it's really part of a larger picture related to disruptions. The total estimated cost of ransomware is expected to be upwards of $265 billion by 2031. That's less than a decade away. And secondly, to succeed as a digital business, there's really no tolerance for downtime from any disruption, whether that's a natural disaster or even a planned disruption or even a human error. And lastly, the acceleration of cloud adoption, hybrid and multi-cloud, has introduced new complexities for IT. Cloud spending was $332 billion in 2021, and that footprint is expected to grow to over 100 zettabytes of data by 2025. So as we kind of been alluding to and talking about, cyber attacks, right, like ransomware, they've become an unfortunate reality in healthcare, and it's really only getting worse. 90% of private sector healthcare organizations have said that a ransomware attack has caused them to lose business or revenue. And 44% of those healthcare organizations took up to a week to recover from that attack, and a quarter took up to a month. Those are huge numbers. And 66% of organizations were hit by ransomware attacks last year, which was almost double what it was in 2020. Healthcare organizations rely on timely, correct, and really protected information to provide the best care. So any downtime or data loss can have devastating effects, and this is where Zerto really shines. In particular, we're really meeting the challenges healthcare organizations face across all the platforms that you use, with a focus on 3 use cases: ransomware recovery, disaster recovery, and multi-cloud mobility. We're focused on these to ensure that all of our customers can achieve a continuous protection for any app, any cloud, and any threat. And really all of this is based on a foundation of continuous data protection, or CDP, which is a space that Zerto has pioneered and been a market over a decade. And to really our secret sauce, we can recover using very granular points in time to minimize data loss to seconds with very little downtime and drastically reduce the impact of that disruption. So whether it's a ransomware attack, natural disaster, or planned disruption, our CDP technology can return you to 5 to 10 seconds before the disruption occurred, all in minutes time. And of course, no matter what cloud platform you use, we have you covered in your journey. Now, our differentiators are simple. We get your business back up and running in minutes with only seconds of data loss, all with the flexibility to test without disruption. Now, how do we do this? Well, as I mentioned earlier, continuous data protection, that's our secret sauce, and that's really made possible with block-level replication. So it's a near synchronous replication, which is the best of both worlds. It's less costly than synchronous, and there's no performance impact like asynchronous with snapshots. And because we sit at the hypervisor level, we're a software-only solution, and we can be hardware and storage agnostic. So you simply can set it up, replicate, and it stays always on to keep you always protected. Now, part of what makes CDP so powerful is the unique journaling capabilities we have. We have industry-leading RPOs of seconds and RTOs of minutes. So this journal tracks every single change made in your application or on your server, and it logs these as checkpoints every 5 or 10 seconds. So if you get hit with a ransomware attack, for example, at 10 a.m., it's really easy to roll back the clock to 9:59 and 55 seconds and completely mitigate that infection. Now, to solve for the challenge of recovering complex enterprise apps, you need to protect your VMs as one cohesive unit. That way you avoid the inconsistent recovery of applications where each VM is being restored to a different point in time. Our app-centric recovery approach actually protects and recovers at a granular level, so all of those VMs are restored in the same state you left off for, and all of your apps are in the same point in time. So this, of course, saves a ton of resources when you're trying to reduce the amount of time dedicated to recovery. Now, whether it's on-premise or in the cloud, we have quick and fast implementation and deployment. It allows you to integrate with your existing tech stack, and it allows you to protect and mobilize thousands of VMs to meet your critical SLAs, right? And with orchestration built in, the manual processes are automated, and again, easy non-disruptive testing and the ability to do it often at any time, even during business hours, is really a key feature that we have, right? And our Zerto analytics provides full visibility and reporting across your sites and ensures full compliance to meet your regulatory needs and provides intelligent, predictive infrastructure planning. Now, with Zerto, you're also able to de-risk your recovery with non-disruptive testing that allows you to reduce the needed resources for testing. We have two healthcare organizations here that have used Zerto, and before they used Zerto, they had several testing resources that they needed to utilize. So Care First actually had 6 testing resources before Zerto, and now after Zerto, they're down to 1. HCA had 23 resources, and now they're down to 6. So with Zerto's simple, scalable solution, we can not only deliver that uninterrupted experience, but we also allow the flexibility to test without disruption and reduce those testing resources as well. And now, staying on this topic of leading healthcare organizations, HCA was actually able to glean $10 million in savings by adopting Zerto. They reduced their DR solutions from 4 to 1, and they reduced their RTO from 4 days to 2 hours. Those are huge numbers. And Kindred was able to reduce their RTO to under 1 day. They reduced their DR solutions from 3 to 1, and they reduced their RTO to under 24 hours, and they were able to comply with healthcare regulations as well. And finally, Centura Health, they were able to see a 47% total cost of ownership savings over 5 years by replacing their legacy SRM and backup solution. So these are, just a few examples of many, and healthcare organizations really can have benefited with Zerto. Now, whether unplanned or planned, I've mentioned this obviously a few times, but it's really critical. But the challenge for IT is to stay protected enough to efficiently handle the reactive nature of unplanned disruptions, while also being nimble enough to innovate through proactive disruptions that deliver business value, right? So whether that disruption is unplanned, like a ransomware attack or a natural disaster, or the disruption is planned, like IT migration or some other sort of IT initiative, handling these outages really needs to be simple, automated, and able to cover 100% of business requirements while minimizing resources and manual processes. Ultimately, Zerto really harnesses all the technical benefits we've been talking about to deliver on these real-world healthcare use cases that you've seen, and be able to get you up and running in minutes with as little data loss as possible. So with that, we invite you to kind of experience what Zerto has to offer with an array of resources and tools that we offer. Whether it's a live demo that's tailored to your specific healthcare needs, hands-on lab that allows you to test drive Zerto from the comfort of your home or home office, or even a free, simple total cost of ownership calculator to see and understand the long-term value of Zerto. We're proud to offer these resources to you so you can experience Zerto firsthand before making your decision. And finally, we also have a great offer to extend to you today. You can try out Zerto at no cost. You can protect 10 VMs for free, and again, see how Zerto can keep you up and running no matter what. Thank you.
Oh man, thank you, Mike, for that awesome presentation, and thank you for joining us, Anthony, for some Q&A now as well.
Absolutely. Thank you for having me, everybody.
Before we jump into some questions, I do want to point out that we do have a poll question up for you again, so please do take a moment to fill that out. What we want to know is what additional information you would like to get about the Zerto solution. So again, just a reminder, this is the absolute best way. Instead of you having to go and dig around and look for all the information you want, they're going to hand it right to you. So just let the team know what information they can send your way, and Zerto will follow up with you. But Anthony, Mike, should we dive into some audience questions now?
Yes, please.
Let's do it.
Okay. Well, I want to start with this one from Matt, and he actually sent this on as 2 questions, but we get this kind of question a lot. So what he's wondering about is okay, if you're dealing with an attack and then you're backing up, is how to ensure that your backup is not infected, and what protections would be in place to make sure that you're not backing up infected files.
Yeah, so I think there is a lot of layers to that answer. The first thing I would say, no, but most importantly is the fact that Zerto is the recovery portion of sort of any disaster recovery that happens from a ransomware attack. So the best solution for that would be, as we would say, maybe create an environment where you roll back to maybe a point in time before it happened. That didn't work, then try again further. So obviously that would be, if this was your only solution to solve that, that would be the best way to do so. But we also suggest leveraging other technologies within your organization that leverage security to really better help pinpoint that point in time to roll back to from a disaster recovery standpoint.
Actually, on that note, can you address when a VM gets restored, are they all different points in time?
So the journal is just tracking the delta changes that are happening within those virtual machines themselves. They are, yes, the actual point in time of when those changes did occur within the hypervisor.
Okay, perfect. Do you need any hardware to run Zerto?
No, Zerto is a software-only solution. It does not matter very much what the underlying hardware is. We are integrated with obviously many of the storage providers, and we operate at the hypervisor level as a software only.
Lovely. Okay. Edgar here is wondering, and I think you actually, Anthony, answered this over live chat, but so the audience can hear as well. He was wondering about the size. Can Zerto handle large VMs?
Yeah, I added something in there. Obviously, there are some limitations to what you're trying to replicate and push through. So if you have a extremely large virtual machine, you can expect it to be protected, but you'll obviously run into some problems and slowness in doing so.
All right. This was an interesting question, and I don't actually know how much you guys want to chime in on this, but I felt like maybe you kind of brushed against it in your presentation, Mike. Eric here was wondering about making a successful argument for, having this, putting budget towards a tool like Zerto, a solution like Zerto. And I think one of the biggest things I heard you say was, reducing maybe the number of people needed to monitor this. Is that what you would say is the biggest kind of ROI, or is there something else that people can kind of take away if they're going to go make an argument for investing in the Zerto solution?
Sorry, was that for me or for Anthony?
Either. Whoever feels excited.
Yeah, Anthony, go ahead. I think you're on a roll.
Yeah, no, because I did answer this one in the chat for sure. So obviously, right, there's a cost to doing this, and the ability to do so granularly comes, probably not at no C-level executive wants to spend or open their purse necessarily, or really think about the potential of these attacks. So what we offer, I know online, is a TCO, so a total cost of ownership calculator. And what I always urge individuals who ask this question is, what is the cost of your business being down? Think about your email being offline for even 10 minutes a day. What does that do to slow down business overall? And take that cost into consideration when you're kind of drafting your presentations as to why this should be a solution for you.
I think that's great advice, and I'm sure there's a lot of people out there that are already thinking about how to make these arguments, so that's a good place to start. Wondering how Zerto is aware of or responding to zero-day attacks, especially a big issue in healthcare.
Yeah, again, it would depend a lot on to the point in time where you would roll back. Obviously, it sounds like that application in that sense would kind of much be toast because it's starting from the get-go. So again, I would say use Zerto as that recovery tool to being able to, let's say, all right, maybe you're aware of that zero-day attack. You want to spin up an environment, replicating it to a sandbox where you might use some other software to fight it. It's really as a disaster recovery and mission critical backup to those applications rather than hey, we're fighting the ransomware itself.
That front line, yeah. Well, maybe Nathan, if you have some follow-up questions for how that might flow through, reach out to the Zerto team and they can kind of give you a little more insight. And I think, I wish we could keep going, guys, because we've got lots of great questions, but I think we're going to have to wrap it up there. But before I let you go, if there was sort of one step for somebody, if they were going to get started with the Zerto solution, what do you recommend doing? What is the first step?
Yeah, you're going to hear me fanboy over this time and time again. Go to Zerto.com/labs, the best way to get on your hands on, right? Zerto on-premise, replicating to Azure, AWS, as well as our new Zerto for Kubernetes environment. You can test and play with it completely free of charge. The best if you're just looking to get hands-on.
Perfect. All right. Well, I think that is a great way to get started. So hopefully everyone out there, for those of you who are looking for some more info, head on over to Zerto.labs or /labs?
Zerto.com/labs.
There you go, Zerto.com/labs. That's your step one for everyone out there. Well, Mike, Anthony, thank you so much for joining us here today. It's been an absolute pleasure.
Cool. Thank you. Always a great time.
And if you are looking for another way, thank you. If you are looking for another way to get some info right away, do head on over to that handouts tab. You can click on the Zerto link and start exploring some great information and resources for you there. And as we say time and time again with those labs, it really is the absolute best way to get comfortable with the solution. So make sure you head on over and check that out. All right, well, thank you to everyone who filled out the poll. And, oh, you guessed it, folks. You've been waiting so patiently, but right now it is time for our very first prize giveaway. So we have a $500 Amazon gift card. A quick reminder that you must be present at the webinar today to win. And our very first lucky winner here with us today is Lynn Ma of California. Lynn Ma of California, you have won a $500 Amazon gift card. So congratulations, to you. I got so excited I couldn't even speak. As always, we will be in touch about claiming your prize after the event today. Don't forget that there are lots more chances to win a prize, plus that best question card from each session. And I'm going to remind you guys that even if we don't get to your question in the live session, there is still a chance to win that best question. And also a reminder that all of your questions go directly to the team as well. So if you asked a question of Anthony and Mike just now that we didn't get to, don't worry, we will get them to the Zerto team. They will be able to follow up with you on and get you some answers. But for now, let's keep moving right along because we are clipping here in our EcoCast. So it is my pleasure to introduce you all to our next fascinating presenter in our EcoCast, Sally Adams, Senior Director at Sophos. Sally, thank you so much for being here with us today. The platform is all yours.
Thank you. Hello, everybody. Welcome to this webinar on the state of ransomware in healthcare 2022. I'm excited to share with you the findings from our latest annual survey into the reality of ransomware that's faced by IT professionals working at the front line of healthcare. The studies revealed an ever more challenging threat environment, together with the growing financial and operational burden that ransomware is placing on its victims. It also shines some new light on the relationship between cyber insurance, which some other sectors have, and the role insurance is playing in driving improvements to cyber defenses. So let me start by telling you where the data that I'm about to share is from, how we've got these findings. So at the start of the year, Sophos commissioned an independent vendor-agnostic study of 5,600 IT professionals. And those professionals came from 31 countries, so it's a really international study. Of them, 381 work in the healthcare sector, so 381 healthcare respondents, so a really large number of healthcare representation. And this enables us to see both the healthcare experience and also compare it with that of other sectors. Now, the respondents are all from mid-size organizations, the 100 to 5,000 employees. So individual small healthcare companies and large hospitals are not covered here. This is that mid-size organization. Now, we conducted the research in January and February of this year, and we asked respondents to respond based on their experiences over 2021. So this is really showing their 2021 experiences. And we didn't actually do the survey ourselves. We commissioned Vanson Bourne, who's a leading independent research organization, to do it, and it was all done to the very high standards of market research. So that's where the data's from. Let's dive into the findings, starting off with the reality of ransomware. And the first big data point I want to share is that 66% of respondents in healthcare said their organization was hit by ransomware in the last year. That's really quite a startling finding. 22% said that they weren't hit but expect to be hit in the future, and 12% said that they weren't hit and don't expect to be hit. Now, It's worth mentioning here how we define being hit by ransomware. We define that as one or more devices impacted by the attack, but not necessarily encrypted. Now, to put that into context, I want to share with you the comparative number from our 2021 survey showing the experiences over 2020. And what we can see is, which is quite alarming, is that the percentage of IT professionals in healthcare that reported their organisation being hit by ransomware almost doubled over the last year. 34% experienced an attack in 2020, 66% in 2021. That's a massive increase over the course of a year. And it's really demonstrating that adversaries are becoming considerably more capable at executing significant attacks at scale. It also likely reflects the growth that we've seen in the ransomware as a service model, which significantly extends the reach of ransomware by reducing the skill level required to deploy an attack. Now, let's see how ransomware experiences compare in other sectors. And this chart here shows the percentage of respondents who said that their organisation was hit by ransomware in the last year. As we can see, healthcare in the purple is right in the middle, bang on average. Now, in some ways, I think it's reassuring that healthcare is not being singled out for excess attacks. But actually, what I think is really concerning is that there's an overall global trend to a high level of ransomware attacks on organisations across all sectors. As you can see, there isn't a single sector where fewer than half the respondents said that their organisation was hit. So this really is a cross-sector challenge. And I think the big takeaway here is that you should expect to be hit. You expect to be targeted, and much better to prepare for the worst and not need it than to be taken unawares. So let's now have a look at what happens. Okay, once the organisation's been hit by ransomware, what happens next? How able are organisations to stop the encryption, and how successful are the attackers in encrypting the data? So this chart here shows how successful cybercriminals were at encrypting data in those attacks. So we can see here 61% of the IT professionals in healthcare whose organisation was hit by ransomware said the cybercriminals succeeded in encrypting their data. This is a little below the 65% global average. Conversely, healthcare had a slightly higher rate. 34% of attacks were able to be stopped before the data could be encrypted. So a little better than average. So that's, you know, good news for the healthcare sector. What's also interesting is the bars over on the right, the percentage who said that the data was not encrypted, but the organisation was held to ransom. And we saw growth in this type of attack over the last couple of years, where the adversaries would steal the data and then kind of extort the victim with the threat of making it public. Now, 4% of IT professionals in healthcare said that they had this experience. This is down from 7% last year. Now, generally, you know, that reductions, are a cause of a celebration, but I don't think that's the case here. What we're really seeing at Sophos is an increase in attacks where adversaries are trying multiple approaches to get money from their victims. So stealing data with the threat of making it public, but then being able to encrypt the data if they're not successful. So it's less of a move away from ransomware and more a move to the kind of two birds with one stone approach that the cyber criminals are starting to adopt. Let's just have a quick look at that data encryption rate by industry. We can see here healthcare has one of the lower rates of data encryption. So it's over on the right. So, you know, cyber criminals are encrypting data in fewer instances than in many other sectors. But again, there's not a single industry where less than half the respondents say that their data was encrypted. So, you know, this is a real global issue across all sectors. Now, this increase in ransomware attacks is actually part of a broader threat environment toughening trend that we're seeing. We asked the respondents about how their experience of cyber attacks generally, not just ransomware, had changed over the last year. And we found that 69% said that they had experienced an increase in the volume of cyber attacks on their organisation. And a similar number, 67%, said they'd seen an increase in the complexity of attacks. So we've got more attacks, they're more sophisticated. And I think it's therefore no surprise that 59% reported an increase in the impact of these attacks over the course of last year. So it really is a much tougher general threat environment that everybody is facing, and ransomware is part of that. Now, what I think is really illuminating is when we compare these numbers with other sectors, which is what we've got here in this chart. So if we see healthcare, it's the dotted box over on the right-hand side. And what stands out here is that healthcare is the sector that was most affected by change in experience of cyber attacks last year. It's got the highest percentage of respondents reporting an increase in the volume of attacks, and it's also got the highest percentage of respondents reporting an increase in the complexity of attacks. And that, added to that, it's second only to the central federal government in terms of the percentage reporting an increase in the impact of attacks. So it's really clear that cyber criminals have no qualms whatsoever about targeting the healthcare sector. They're increasing the complexity of attacks to try and get around the healthcare sector's cyber defences. So yeah, this really demonstrates the challenge that healthcare is facing and how much tougher the job has got for you all over the last year or so. Now, let's have a look at what happens, when data has been encrypted in a ransomware attack. And the good news is that almost everyone in healthcare got some encrypted data back. I think as ransomware has become more prevalent, organizations have got better at dealing with the aftermath. Now, this 99% is actually quite a big jump from last year when only 93% got some encrypted data back. So more healthcare organizations are getting data back once it's been encrypted. The number one way that they did that is through using backups. 72% said that they use backups to restore encrypted data. This is good news. We've been talking about the benefits of backups, the importance of having good backups, practicing restoring from backups for quite a while. So well done to everybody who used backups. At the same time, 61% said that they paid the ransom to get their data back, and a further 33% said they used other means to restore data. Now, clearly, these numbers add up to more than 100%. And what we're seeing here is that many organizations are using multiple restoration methods in parallel to maximize the speed, the efficacy with which they can get back up and running. In fact, in healthcare, 52% of those who had data encrypted used multiple methods to restore their data. Now, this isn't just a healthcare phenomenon, it's happening across many sectors. Perhaps one of the most public ones was the Colonial Pipeline attack last year, where there was a lot in the news about the fact that the ransom was paid, but actually the decryption tool recovery was so slow and difficult that in parallel they used backups, and they actually got their data back from backups faster than they did through the decryption tool. So this is a common trend. We saw on the previous slide that 61% of healthcare respondents whose data was encrypted said they paid the ransom. This is showing us how healthcare stacks with other sectors. And as we can see, healthcare is by far the sector most likely to pay the ransom, and by quite a large margin as well. In fact, the global ransomware payout rate is a full 15 percentage points higher than the global average here. Now, we know that lack of backups is not the issue. We've just seen 72% said that they use backups to get their data back. So what's behind this high ransom payout rate in healthcare? Well, one possible reason, as we're going to see a bit more detail in some future slides, is the high operational and financial impact of ransomware on healthcare organizations. This could be forcing them to rush and get back up and running however they can, using multiple methods as well. So it could explain both the high ransom payment rate and also the high percentage using multiple methods. The consequences of being impacted by ransomware, can be really quite life or death in the healthcare industry. So that may be spurring more to pay the ransom. However, paying the ransom doesn't guarantee you all of your data back. We've seen that pretty much everyone gets some data back. Let's have a look at how much data those who pay the ransom are able to restore. And the answer there is 65%. On average, organizations that paid the ransom in healthcare were able to restore 65% of their data, so 2/3. And of course, you're not choosing which 65% it is you restore. So it's not that you can choose what you want and what you don't want. And this is actually a reduction from 2020, when we saw that 69% of data was restored in healthcare. Similarly, we see a reduction in the percentage that got back all their data after paying the ransom. 2020, 8% in healthcare who paid the ransom said they got all their data back. That's now down to 2%. So that's quite a major drop there. Now, this is really clearly saying that getting your data back is not guaranteed by paying the ransom. Put your focus on backups, practice restoring from backups. That is a much more reliable way to restore data. Now, it's worth saying that I don't think this is a deliberate ploy. I don't think the adversaries are deliberately only giving people 2/3 of their data back. Rather, it reflects the fact that they put all of their focus, their effort on the encryption tool, because they need to encrypt your data to hold you hostage. They're putting less focus, less effort into the decryption tool. So it's rather a lack of focus than an investment on behalf of the cyber criminals than a deliberate strategy. Because of course, if they didn't restore any data, then their business model wouldn't work at all. So I've talked about paying the ransom quite a few times. Let's now take a look at the actual ransom payments that were made. Now, 965 respondents across all sectors whose organisation paid the ransom shared the exact amount. So this is a really, really wide sample set that we have here. So really broad insights for that mid-sized organisation sector. And what we saw is not really good news. A threefold increase in the percentage of respondents paying ransoms of $1 million or more, up from 4% in 2020 to 11% in 2021. And whilst the percentage paying large ransoms has gone up, the percentage paying small ransoms has gone down. This time around, 21% reported paying ransoms of less than $10,000, which is down from 34% in 2020. Overall, the average ransom payment came in at a very large $812,000. This is a 4.8-fold increase from the 2020 average of $170,000, so a massive increase. Now, this average here, it is inflated by 15 8-digit ransoms, so $10 million or more. So that has pulled up the average. But I think when we pull all of this together, increased percentage paying more than $1 million, decreased percentage paying less than $10,000, higher average ransom payment, it really talks to a global upward trend in terms of ransom payments, even though it's not getting organizations any more data back. We saw just a moment ago that healthcare is the sector most likely to pay the ransom. Let's now have a look at the average ransom payments in the healthcare sector. And what may surprise you, having had healthcare right over on the left-hand side, the highest on the earlier chart, is that healthcare actually makes the lowest average ransom payments of all named sectors. It's right over here on our right-hand side. The average ransom payment in healthcare last year was little short of $200,000. It was $196,000. Now, this low ransom payment comparatively is likely driven by the constrained finances of many healthcare organizations, particularly those in the public sector. They simply don't have the money for attackers to squeeze out of them. In addition, healthcare reported very few 7-digit or more ransom payments, so it didn't have those big numbers that were pulling up the average, which some other sectors had. At the same time, of course, let's not lose sight of the fact that $200,000 is a very large amount of money, and that's going to have a major impact on pretty much any organization. Just to break down that healthcare average ransom payment in a bit more detail, this is based on the 83 healthcare respondents who paid, so it's a really quite significant number of healthcare respondents we have here. We can see that 60% paid less than $50,000, and in fact only 3 paid $1 million or more. So hopefully this gives you a really accurate, granular breakdown of the sort of payments that are being made in the healthcare sector. Now, while of course it's great that healthcare has the lowest average ransom payment of all named sectors, before we get too carried away, just to bring us back down to earth, the reality is that that average ransom is still a 50% increase year on year from the 2020 average ransom, which of $130,000. So while it's good to be on the lower side, healthcare is very, very much affected by this upward global trend in ransom payments, and this is a concern for all of us. Let's now have a look at the impact of ransomware on an organization. And I want to share with you the operational and business impact here. We asked those organizations hit by ransomware, did it impact their ability to operate? 94% said yes, almost, 19 out of 20 there, and I think that potentially is driving the high frequency of ransomware payments in this sector because of that huge, impact on ability to operate, which, can be really quite critical in the healthcare industry. Similarly, 90% said that it caused them to lose business and revenue. Now, this question about lost business and revenue, we only asked to private sector healthcare organizations. So public organizations that don't generate revenue, they were excluded. So it's a slightly lower number of respondents there. But either way, both of these numbers really demonstrating the massive overall operational impact that healthcare has when it's hit by ransomware, and really helps demonstrate the benefits, the importance of for taking steps to prevent the ransomware attack, to prevent the data encryption in the first place. Now, we saw the ransom payments and that the healthcare was on the very low side globally compared with other sectors, but the ransom payments were just a small part, of course, of the overall remediation cost. And when we asked organizations about the average cost to rectify the attacks, taking into consideration downtime, people time, device cost, network cost, that sort of thing, healthcare is actually quite considerably above average. The average remediation cost came in at 1.85 million in healthcare last year, which is quite a long way above the global average of 1.4 million. And in fact, it's second only to construction and property here. Now, the reasons for this, high overall average cost, when we've seen that the ransom payments are quite low, there's a few possible reasons here. Potentially the high data breach notification costs. A lot of the data in healthcare is personal information. Therefore, when it's stolen or when it's accessed, there's a lot of people to notify, and that has a really high cost attached to it. And there's also potentially hefty regulatory non-compliance penalties because of the attack, because of the data being breached. It may also be a reflection of the fact that many healthcare organizations have quite poor standards of cybersecurity, so they're forced to invest quite a lot of money to get their systems up to where they need to be after the attack. So quite a lot of recovery and costs for getting better levels of cyber defenses. I suspect it's probably a combination of all three and potentially some other factors depending on the particular organization. And then just to kind of hammer home this point, this compares the remediation cost total from last year, 2021, which we have on the left, with the previous year, 2020, on the right. Now, globally, there was an encouragingly a downward trend. The average remediation cost globally dropped from 1.85 million in 2020 to 1.4 million last year. So that was really encouraging. Unfortunately, healthcare bucked the trend. Healthcare actually saw a really quite significant increase from 1.27 million in 2020 to 1.85 million last year. So over, almost a $600,000 increase in remediation cost. Again, another, point to demonstrate the importance, the value of investing in stopping threats early, preventing the attack from hitting the organization, preventing the data from being encrypted, to keep these big numbers down. So let me now share with you some top 5 Sophos top tips to help you minimize your exposure to ransomware. The first is having high quality defenses at all points in your environment. You want to stop the threat as soon as you can. Stop your organization falling victim to attack. Prevent the adversaries from, moving around your network. Stop them getting in, stop them moving around so that they can't deploy their ransomware. We also need to proactively hunt for threats. Attackers increasingly using legitimate IT tools to move them around the network. You need to look for those signals that there's an adversary who's got you in their sights. If you don't have the skills, work with a partner who can help you. You need to harden your environment, remove any weaknesses, any gaps, any spots that the attackers can use to get in. An XDR, extended detection and response tool, can be really helpful here. Also have a cyber incident response plan. Know what you're going to do if an attack hits. This will help with your recovery time, will help reduce your costs. It will also help, frankly, with securing cyber insurance. Showing that you are ready to respond if an event occurs, that you know what you're going to do, will give confidence to the insurance provider that you are the type of organization they wish to secure. And also make backups and practice restoring from them. We saw that backups were the #1 way that healthcare organizations were able to recover their data. Let's get that up to 100%. The more you can use backups, the better you can get your data back, the less that you are held hostage to a cyber criminal, and really practice restoring from them as well. So ongoing tip there is around backups. So I'd like to close out this session by touching on how Sophos can help with many of these areas. The first is in terms of the high quality defenses at all points in your environment, and we've got a number of ways we can help you here. Firstly, in terms of automatically blocking ransomware threats before they can be deployed. Our endpoint and workload protection is packed with advanced ransomware protection capabilities that disrupt the whole attack chain, including anti-ransomware technology to detect and roll back the unauthorized encryption of files, shutting down processes before they can spread across your network. Sophos Email automatically analyzes file processes, file activity, registry activity, and network connections to block ransomware and other forms of malware. And its advanced phishing protection helps prevent malicious messages from reaching your users' inboxes in the first place. And Sophos Firewall protects from compromised sites and malicious downloads with extensive machine learning and sandboxing inspection for file downloads to identify new, even previously unseen forms of ransomware. Next up, I want to mention is around locking down your remote desktop protocol. Now, this RDP may seem like old news, but I really want to emphasize it here because in over 80% of the incidents last year where Sophos's incident responders were brought in to remediate an activist attack, they found that the attackers had been using RDP for internal movement. They've been using it to make their way around their victims' network and to help them advance and carry out their ransomware attacks. So it's a really prevalent tool that's used by attackers. Sophos Firewall is an elegant way to easily manage and lock down your remote desktop protocol. At the same time, Sophos XDR, Extended Detection and Response, detects RDP connections and logs that activity. Remote Terminal allows administrators to enable or disable RDP policies on any devices, and it provides visibility into RDP policies and detects changes to it. So you can see what's going on with your RDP. And Sophos Cloud Optics proactively identifies exposed RDP ports via public cloud security benchmark assessments and provides guide remediation to address misconfiguration. So lots of tools there to help with RDP. Thinking about the cloud, really important to identify and mitigate vulnerabilities in cloud environments. Adversaries move fast in the cloud. If there is a weakness, it's not a case of if it will be discovered, it's a case of when it will be discovered. And Sophos Cloud Optics is a powerful tool to really help you there. And then finally, proactively providing cybersecurity awareness training for your users. We are all the front line. We are all subject to to adversaries attacks. So we need to keep up to date with our phishing training. Adversaries are constantly changing tactics. They're constantly changing approaches. We need to ensure we all stay fresh and alert to their approaches. And we can really help you there with our Sophos Phish Threat tool. The second tip was proactively hunting for threats. This is essential. This is that kind of EDR element that is often required by cyber insurance providers because they understand that, with adversaries using legitimate tools, often there isn't a malware trigger until later on. So, you need to find those signs that the attackers are in your environment so you can neutralize them before they carry out their attack. And we can help in two ways here. We have a 24/7 managed detection and response service called Sophos Managed Threat Response. Our experts do threat hunting, investigation, neutralization for you, and they can do it, all around the 24 hours of the day, 7 days a week. So that's a full expert threat hunting service provided by Sophos. Similarly, if you want to do it in-house, our Sophos Extended Detection and Response XDR tool gives your experts, really professional tools that they can use to detect, correlate signals, investigate and neutralize incidents. And if you want us to do it together, well, we can do that too. Many customers like to do their threat hunting themselves during the working day, and then Sophos takes over evenings and weekends. So very much we can partner with you there too. The third point is around hardening your environment. I was just mentioning Sophos Extended Detection and Response, and as well as being a great tool to help with threat hunting and neutralization, it's also a great tool for you to manage your IT operations, to see and address security gaps across your environment. Just down in the pepper boxes are some of the different things, some of the many things you can do with Sophos XDR. And I want to highlight particularly that second one around checking vulnerabilities, finding vulnerabilities in your environment. I mentioned, the Sophos Incident Response Service. When we've been brought in to help organizations experiencing an active attack, 47% of times last year, the way the attacker got in was through exploiting an unpatched vulnerability. They are using vulnerabilities to get into environments. The number one way that they're getting into victims' estates in the instance we help remediate. So checking for vulnerabilities is key, and I encourage you to do that as the first opportunity. And then finally, having a cyber incident response plan. I mentioned this is going to help you speed up your response. The quicker you can get back up and running, that also then reduces the cost of the incident, and it helps you with your overall cybersecurity posture. If you're using our managed threat response service, so our 24/7 threat hunting, that includes automatically emergency incident response. So you have us there already as your go-to team should there be an incident. Alternatively, we have our rapid response service, which any organization can call on, Sophos user or not, to help with incident remediation. They've dealt with thousands and thousands of incidents across the globe. So, if you have an incident, do call on us. If you want to take a look at the findings in a bit more detail, or look back at any of the charts I've shared today, we have a PDF version of the report, State of Ransomware in Healthcare 2022, which is freely available from our website. So with that, I'm going to say thank you very much for your time. Thank you for your attention.
Oh, Sally, thank you so much for that awesome presentation. Such great information. We got a lot of high fives from the audience as well, so I know that was resonating I agree. Peter made the comment that it was addressing a lot of questions that we have about the details behind headlines. And I very much agree with that. So Sally, thank you so much. You can all see that I put up a poll question for you again here. What we're looking for is what additional information you would like to get about the Sophos solution. So I've mentioned this before, but so often we get bogged down with just tons and tons of information overload, and it's hard to know how to get started. So this is a really nice opportunity to literally just let Sophos know, here's the checklist, here's what I want, here's what you can send me that's going to help me evaluate if this is the right solution for me. So take advantage of making your life easy. Click on the poll. Let them know what additional information you would like to get. Now, I know we've got a lot of really great questions coming in. Unfortunately, we are going to have to keep jetting along in the EcoCast today. We've just got a lot of information to get through, and we're short on time. But don't worry. Sally and the Sophos team are going to follow up with you. We're going to make sure that they get the questions that you ask, and they will get in touch with you to make sure that you are getting the answers you need. And before we move on, I do also want to remind you all again about that handouts tab. So if you haven't already checked it out, click on the Sophos link. You can get the white paper, The State of Ransomware in Healthcare 2022. This report explores findings from an independent vendor-agnostic survey of 5,000 plus IT professionals in mid-sized organizations, including over 300 healthcare respondents across 31 countries. So really, really, really interesting report. Lots of great information there. Be sure to head on over, download that, and save that for later. And I'm going to leave the poll up another couple of seconds longer, give you all a chance to respond. Again, just a great way to reach out to the Sophos team. But we will have to move it along. So last chance to click. If you haven't clicked already, run, and done. All right. So up next, I am so excited to introduce you all to our very next presenter on today's EcoCast, Zach Palakia. Zach is a senior sales engineer at Rubrik. Zach, thank you so much for being here with us on the EcoCast. The mic is all yours.
Thank you. Again, my name is Zach Palakia. For 10 years, I've been a data protection specialist. And today, I'm going to kind of give you a slight overview on Rubrik and how we're helping solve, taking the pain out of backup recovery and solving kind of some of the healthcare's top challenges. First, a little bit about what we see in healthcare today. Obviously, with COVID, there's been a huge increase in telehealth and remote work and the need to work remotely. In addition to that, organizations are starting to use more AI in the healthcare space to do things like, cross-reference blood work with, image data and things of that nature to help doctors be more accurate in their diagnosis. And then with all of these trends that we're seeing across the industry, what we're seeing in regards to those challenges is, one, the growth of data volume. Obviously, with patient care, there's a lot of information that has to be stored and recorded. And in addition to that, those AI apps that I spoke about generate tons and tons of data in order to correlate different data points. With that, obviously comes cost management as well, and pair that with the influx of ransomware attacks that are targeting healthcare organizations. Lots of operational complexity with still a lean amount of resources inside of healthcare organizations on the IT team, having to kind of basically do more with less. So today, the challenges we'll kind of talk about is how do I reduce my complexity? And with that, how am I getting time back? And then we'll also talk about simplifying other things like your cloud journey and your security posture, and then what else you can get out of your backup infrastructure. Just a safe harbor statement, the opinions expressed in this presentation is solely the personal opinions of the individual presenter, not necessarily reflect the opinions of Rubrik. Always, work with a security professional for advice on your security posture. So the first things first, how do we reduce complexity? Interestingly enough, 30 to 40% of companies don't actually back up their data. In the healthcare space, that's highly unlikely. But in the world of agile IT, there are many different users creating new servers, shares, and databases. I spoke about those AI teams that are developing new AI products. Usually those are a siloed team. You might have an infrastructure team, a cloud team, and a backup team all on separate kind of teams inside your organization, and even maybe security organizations. And the problem is, even in the biggest Fortune 50 companies, because there are so many teams, there's not always a process for everyone to follow to configure backups. And there's a lot of scenarios where someone might create a new workload or application or VM and forget to back it up. And even when there's well-defined process, there's always the possibility of user error. One of the great examples I like to say is, I've walked into plenty of organizations and asked a room full of people, are you using cloud today? And I get the response, no, we're not. And then someone else at the other side of the table says, yes, we are. We're using it for this, 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 and this. And it just kind of goes back to the silo of IT. So we'll talk about how Rubrik solves these problems. A traditional approach to backup is essentially a legacy approach. So each organization, a healthcare organization, is going to have RPOs that they set, RTOs, archive policies, and retention requirements for compliance, right? And if you give all that information to 3 different backup admins, or even 3 different backup products, each one of them is going to have their own logic, their own best practice, and maybe tribal knowledge. And what they'll do with that information is configure backup jobs with a group of different types of objects. Then they'll set up schedules, and then blackout times, exclusions, some tape, and then maybe garbage collection and resource reclamation periods. And you can't kick off, let's say, like 2,000 VMs at one time, right? So what you'll see organizations do is then create another set of backup jobs and schedules, and then another set for load balancing on the back end. So your VMware environment might have backups at 8 p.m., 10 p.m., and midnight to kind of space things out a little bit. And then if you add in workloads like SQL, Oracle, and NAS, usually there's a dedicated policy for all those different things, or maybe even cloud. With this comes a lot of complexity. So let's talk about how we get our time back. With Rubrik, we have SLAs instead of schedules. So if an organization gives us their RPOs, their archive, and their retention, no matter who uses it, it's simply put into an SLA. And the way this works is this is what our SLA looks like. It's a screenshot from our UI. And on the left-hand side is basically our RPOs. How much data are you willing to lose? Or in other words, how often do you have to run a backup? So if, let's say my RPO is every 4 hours, I can simply put 4 hours in here in the window, and then I'll do a backup every 4 hours rather than creating a backup job or schedule for 8 p.m., noon, or midnight rather, 4 a.m., 8 a.m., and noon, right? So you can see it's a lot easier. It allows me to stay with one policy instead of multiple policies and schedules that I might have to add every new workload to 5 or 6 policies to get what I want. I can kind of add it to one policy regardless to here to match my requirements. Now, we also do load balancing on the back end using VMware APIs so that we don't affect how many your data stores or your server environment. We make sure that we're only kicking off enough VMs that we don't do any impact production in any way. So the load balancing is all automated for us. And then for each frequency of backup, we also have a retention. So we can define how long we want to keep our hourlies, how long do we want to keep our weeklies, how long our monthlies and yearlies. And what's also interesting is our dailies. Our hourlies become our dailies become our monthlies, and our monthlies become our yearlies. And Rubrik is smart enough to actually figure out, hey, if we missed a day of backups or an hour of backups, I'm just going to take the next one that was successful, and I'm going to make that my monthly backup or my yearly backup. Where most backup administrators have to log in on the first of the month, maybe the first of the week, and make sure that their weekly job ran or their monthly job ran, because a lot of scenarios that might go to a different archive or a different medium. Maybe sometimes it goes to tape and sometimes it goes to storage. So we're solving that complexity by doing it directly in one policy. And then in that policy, we also set our replication. So if I want to replicate to another rubric cluster, or if I want to archive off to either on-prem NFS or object store or the public cloud, I can do that as well. And also a single SLA can hold VMs, databases, NAS workloads, and in some circumstances, even cloud workloads. So again, I have one policy. It's really easy for anyone that's building or automating deployments of new machines to pick one SLA because that's all I have to choose from, right? It makes life a lot easier. And again, with the Rubrik AI, we're taking all the kind of architecture and hard work out of scheduling this stuff out of it and automating that for you on the back end. So once we've done backups, another thing I find really interesting from a compliance standpoint. So anyway, I had a customer that basically every quarter would spend 2 weeks taking all their backup emails and putting them into an Excel spreadsheet. And that's how they would tell their management that they were meeting all their RPOs. And it was very time consuming. With Rubrik, you can see here we have an actual report where we're running almost 16,000 jobs per day. And that's a lot of data to kind of filter through and provide a report to a director level. So what we invented is this compliance report. We only actually have 650 objects. So what that means is maybe for RPO reasons, we're doing backups of one of these objects multiple times a day. Maybe they have multiple disks. Maybe they have a SQL database or multiple SQL databases on them. So we provide this nice and easy report. I can click on and say, hey, all of my objects have hit the RPOs that I set for my organization on the hourly, weekly, monthly, and yearly level, as well as the retentions that are associated with them. And then in the bottom right, we also have what I particularly like with a lot of backup products out there. Storage is a separate product, right? And I have run into multiple organizations that run out of space on their backup platform because they're not really thinking about it from day-to-day perspective. So at Rubrik, we're able to tell you, based on your change rate, which we also gather for you, you can see that on the screen, we can tell you exactly how many days until you're going to run out of space on the Rubrik platform. And you can remedy that either by buying more storage or changing your archive policies to move that data to another cheaper place. At Rubrik, we also work to automate everything. So we integrate with ServiceNow. I've had a lot of organizations say, teams out of the backup teams are like, hey, I don't want to learn another product because I might not use it for 6 months when I need to do a restore. So ServiceNow is a great way to handle that because I can do all my workflows through ServiceNow even when I'm deploying new workloads. I can auto-protect those new workloads as I create them. Same thing with VRO, VRA. I can do monitoring via Splunk and check audit requests of what users are doing inside of Rubrik. And I can also, for my EMRs and EHR systems, I can do scripting of the backups with things like Chef, Puppet, and Ansible. And if I'm doing things in cloud, you can automate via Terraform. So next thing we'll talk about is how to simplify your cloud journey. I think a lot of healthcare are still a little bit cloud adverse, but I've seen an uptick in organizations looking to at least utilize it on some level. So the first way we can do that is just leveraging the cheap and deep nature of object storage in the cloud. With Rubrik, we can back up data and then tier your older data that you're going to retain just for compliance and governance data up into the cloud. Once that data has been tiered off, we can actually use it to spin up VMs in Azure or AWS and use that for cloud migration purposes or DR use cases. And then if you're a little more mature in the cloud and you've already got workloads up there, or during your migration you want to start protecting them, you can also protect Azure, AWS, and GCP natively through our cloud native protection. With zero infrastructure, I might add, which is pretty awesome when you talk about cost control in the cloud. Next, we want to talk about increasing your security posture without adding too much complexity. We believe that if you're going to assess a backup product, you should be thinking about the following things. First is audit and compliance reporting. You want to be able to see what users are doing when they're logged in, how often they're trying to log in, if they have failed login attempts. So we're able to gather that information and port it off to something like a Splunk or ServiceNow for you to do ticket creation or what have you. In addition, you should add an encryption both in flight and at rest, and then some type of SAML integration with MFA or TOTP. If you're doing any banking, probably would not use a bank that didn't have multi-factor authentication. If backup is the last line of defense in ransomware, which it really is, then you should have a product that's fully secure. And if you don't have an MFA provider today, TOTP is actually free through Google Authenticator or Microsoft Authenticator, and it works with all your LDAP accounts or AD accounts and the local accounts on the box as well. And lastly, we would like every backup product to have robust RBAC. We believe in least privilege, and that each user should only have access to what they need access to. With that, we're also raising the stakes a little bit with some things that we do that we find really unique. First is immutability. So we achieve immutability through a two-step process. The first is a logical air gap via a zero trust design, in which case, in order to get to our file system, we don't have it on open protocols like NFS or SMB, because if you think that your production NFS or SMB shares aren't safe in the event of a ransomware attack, then your backup data, storing your backup data there probably is not a good idea either. So in order to get to our file system, we have secure RPC calls, and that's the only way that you can talk to it. It's a lot harder for hackers to get to that, especially in a zero trust world. It's also an append-only file system, meaning that even if you were to get through all those layers of security, the file system itself was designed so that you cannot do delete or change commands. You can only append files that allow you to track changes. So you couldn't modify the data even if you want to, which assures that your data will be there and be available when it's time to recover. Lastly, is the third piece in this whole puzzle is the retention lock SLA, which is FINRA Rule 4511 SEC 17A4F worm compliant. It essentially means if I turn this on one of my SLA policies, no one can modify the retention, the backup frequency, or anything else inside the SLA. You can't remove objects from it either. So it means you're safe from internal bad actors, or if somebody were to get access to the device per se. And then we also have a hardened platform with a stripped down version of Linux that only has the commands that we think are required to run and only signed rubric services can run on the box as well. And that's straight out of the box. There's no configuration needed for any of that stuff. And that's why, but I also point out, immutability is a must in a proper defense against ransomware. Some other ways that we're up-leveling the conversation and ransomware is instant recovery. So we actually did a POC recently where we were able to do 700 VM live mounts in 1 hour and 27 minutes, which is really impressive. Like that's borderline replication speeds. So we can recover very quickly. And then I already mentioned the immutable file system, which makes sure that your data will be available if a ransomware attack occurs. And then the third way we're up-leveling is we're actually able to detect ransomware in an environment based on what files are being accessed and anomalies within the files. We can also scan for entropy, which means encryption on a file. And then we'll give you a UI version of the affected files, so you can recover just the files that were infected, rather than restore the whole VM itself or the whole NAS share, which can be very time-consuming in general, and you may actually delete some good data along the way. And that brings us finally to what more can I get out of my backup? Just like with our ransomware detection, we can also detect HIPAA, PCI, GDPR, CCPA type information. So all your sensitive information that you've backed up, whether it's on a VM, Windows system, Linux system, or a NAS, the more data that's in your environment, the harder it is to find these types of data. And then these regulations are constantly in flux. So they become harder and harder to make sure that you're actually hitting all your regulations and requirements. And obviously you're doing this with usually the same amount of resources as the data grows and as the regulations become more important. So it's harder for your teams to be able to achieve. And again, this is completely agentless. So in your VMware environment, I don't have to install anything in production. All the scans happen on the backup data. Same thing can be said for our ransomware detection. It's all on the back end. And then from a NAS perspective, this tends to be a challenge with most healthcare organizations. We've got one of the best NAS solutions on the market, in my opinion. We can scan billions of files, and we can move billions of files, and also giving you those robust indexes all along the way. With that, the closing statement really is, your data protection should do more. A lot of these data protection solutions are really expensive. And they don't do much other than the couple hours a night they're doing backups if you're not doing restores during the day, right? So you should look for a solution that does more than just backup. You should look for something that's helping you with cloud mobility, helping you automate, helping your data governance solution and giving you something to find HIPAA data, and then cyber resiliency, detecting ransomware, being secure against it, things of that nature. And that's all I've got. Don't back up, go forward.
All right, Zach, thank you so much. What an interesting presentation. A lot of great info and takeaways for our audience here today. And I can see that the audience is very much enjoying the presentation. We have a lot of really great questions coming in, so I want to make sure that we get to as many of those as we can. Let's start with this one here. Okay, so first question, is Rubrik application aware?
Yes, so we can achieve that multiple different ways, depending on what you want to do. We have a great integration with SQL and Oracle, but we can also be application aware from like a VMware snapshot capability. We do VSSQSs as well, so we have multiple ways to achieve that.
All right, great. Well, we also have a few questions here about the scalability of the Rubrik solution. So specifically as the backup data grows over time, and I'm wondering if maybe that kind of ties back into also where would the backup data be stored? Are we talking about on-prem options in the cloud or maybe both?
Yeah, so we have multiple flavors, both on-prem and in the cloud. What I really love about Rubrik is it's a hyper-converged solution. So as you scale the amount of data in your environment, you're getting more and more resources. So for example, each brick, which is a 2U appliance with 4 nodes, can do anywhere from 20 to 30,000 IOPS. So if I expand that, I now have 40 to 60,000 IOPS. So now I have more performance to do restores, right, or to do more backups. And we size them differently as well as with any hyperconverged solution. And that's what allows us to do things like 700 VM live mounts in an hour.
Wow, okay, well, that's awesome. Next question here, wondering about integration and specifically about how easy it would be to integrate Rubrik with existing ERP APIs like SAP HANA.
Yeah, so we have a fully certified SAP HANA solution. I think we can get a white paper out to you on that, or if you want to reach out, we can find one. But we have one fully certified on SAP's website.
Perfect. Okay, so some good follow-up options there. And let's get to another question. Okay, so they're wondering, my security team has tools that do ransomware detection. So why do I need that in my backup solution?
Yeah, that's a great question. So if you think about it, I've seen tools print out a list of 100,000 files that may have been detected by ransomware. if you're a backup administrator and you get a list of 100,000 files, are you really going to sit there one by one and restore them? Probably not, right? So where you need to close the gap is the infrastructure team might have tools, but when you're given a report, what are you going to do with that report? So basically the way we see it is if you can have a UI that already has those files detected and you can cross-reference it between the two tools, you now have a solution where you can not only detect in real time, but also recover very quickly.
Yeah, absolutely. And that recovery is just so critical, especially obviously when you have a ransomware type event. Well, I hate to say this because we've got a lot of great questions still here, but I think we are running a bit low on time today, Zach, so we will have to leave it there. But thank you so much for an absolutely wonderful presentation and for sticking around to answer some questions.
Thank you.
All right, and you can all see that I have put up the poll question for you. We would love to hear from you what additional information you would like about the rubric solution. Now, I know that we did not get to all the questions in that Q&A, so I know some of you still have questions burning a hole in your pocket, so please do take a minute now and let the rubric team know how you would like them to follow up with you, what additional information you would like to hear. And again, a big thank you to everyone who's answering these polls, submitting questions, and of course to Zach and the rubric team. I do want to remind you all that the questions do go to the teams after we wrap today, so you will still get an answer back from Zach from rubric once we've kind of wrapped up today. So keep those questions coming in, and you are still entered to win the Best Questions Asked prize. And we're looking at those at the end of our webinar, and we're looking at a winner from each session, even if we don't get to your question live. So keep those questions coming in. If you are looking for more information right away, I also want to remind you to head on over to that Handouts tab. You can check out the rubric link and explore the rubric site a little bit more. Book that demo right now. As we said before, just the best way to get to know a solution. So spend some time exploring rubric. Both their resources and their demos are top-notch. So go check it out. And while you are clicking around on the poll in the handout section, how about a prize giveaway? It's about that time again. So we're going to do another $500 Amazon gift card, and I'm going to remind you all again that you must be present here at the webinar in order to win. So our next winner of a $500 Amazon gift card today is Jean Malone of Massachusetts. Jean Malone of Massachusetts. Congratulations to Jean on your $500 Amazon gift card. We're going to follow up with you after we wrap today. And as always, again, a reminder that there's more chances to win, so stay tuned for those. Plus, that best question asked that we were just chatting about, so make sure that you're getting those questions in. But for now, we're going to keep moving right along in our EcoCast because we have another exciting presentation here for you all. So let's chat ahead here. Up next, I am so excited to introduce you all to two absolutely fascinating speakers from RingCentral. I know you guys are going to love this session. So introducing John Pulley, Healthcare Industry Principal, and Lance Mahaffey, Senior Director, Healthcare Product Marketing at RingCentral. John and Lance, thank you so much for being here with us today. I know that we are all pumped up and ready to hear what's going on at RingCentral. So without any further ado, the platform is all yours.
Thank you, and welcome everyone to this part of the session. So John and I are going to be talking about supporting the new era of digital patient engagement, and more specifically, as you're assessing IT products for healthcare operations efficiencies, you really need to take a hard look at those legacy phone and patient engagement systems. So the last 2 years have been really eye-opening in terms of identifying where the gaps are in these technologies. Clearly, when patients are visible and actionable inside the hospital or the clinic, it seems like communications are pretty fluid. But when it comes to interdisciplinary team, when it came to accessing outside resources and specialists, most importantly, getting staff to work in a hybrid remote mode, and meeting with patients, that's where the communication gaps really manifested the last couple of years. And in particular, when patients are at home, clearly they're distant. That's when all the self-care complications can arise. And that's also too when the gaps in current communications technologies showed up and the inability for patients to be able to reach their providers in a very agile and friction-free use case. And so what also helps is the periodic voice and video check-ins to help improve patient outcomes, especially those with chronic care conditions, those that need periodic check-ins beyond their scheduled in-office appointments, and the ability to seamlessly communicate with them and get that accomplished. And then interestingly, in 2021, well into the last couple of years of our health crisis, voice-only telehealth visits grew by 30%. So patients are realizing that it's just particularly handy to reach their providers with quick questions or redirections on their care pathways and their care plans. But how easy is it for those patients to connect with their providers? And so as these opportunities grow, providers are going to need newer engagement solutions to be able to effectively engage with those patients in the new era of digital communications. And in particular, with the expanded telehealth CPT codes around voice-only engagement. They're going to need tools that streamline scheduling. They're going to be able to track their calls and be able to report on that if they're going to be able to reimburse for those voice-only visits. And they're going to need better collaboration tools. Most providers, when they really examine where they are today with their communications, they're going to find that these basic fundamentals of digital collaboration are largely missing. So, John, when providers take a look and they assess their current IT environment, and particularly around phone systems and in patient engagement platforms, what's the current state?
Thanks, Lance. What we see right now is the use of these digital tools being applied as we now re-enter a post-COVID stage where people are going back to the doctors where they used to, but at the same time, the digital engagement tools they used during COVID and a lot of the services they used during COVID, they want to keep. So the technology is continuing to evolve. What we see is instead of having a single point of call management where you have a central office where an administrator is taking calls and calls in the morning, we're seeing a lot more need for a distributed set of users to answer calls and distributed set of personnel to work with calls to help divide that. We're also seeing a big need for self-service and other activity in those tools. The other things we're looking for is a more comprehensive awareness of the care team. One of the things that came out of collaboration tools that were used during a digital era where you had to have a remote team is an awareness opportunity. And those are issues that we see are part of the digital engagement where you know where the care team is and there's an access to that from the classic basic park and transfer to something where you actually know and understand the awareness of where the team is and you do direct routing to the actual care providers. The other thing we're seeing is the old world had voice only, where now we have a lot more tools in terms of messaging tools, collaboration tools, digital tools, and telehealth and video that are also part of it. So we're seeing a merger of those two worlds where you had the classic era of office work now going on with a new set of digital tools to manage the care, combined with the concept of virtual care. And as Lance mentioned earlier, we're seeing a big growth in both voice and telehealth as part of the care continuum. So now every care provider out there needs to have a remote care model of some sort. This puts even more stress on having a strong digital tool set to coordinate care activity, coordinate access between patients and care teams, and to make sure that we're following up with much more comprehensive communications infrastructure. Then finally, as we go mobile, as we start to move this into an era where we really want to give the provider team the ability to continue to drive high quality care, but a much more flexible environment in which to do that, to allow the professionals to basically drive better workflows, better quality of life, and re-engineer the way care is provided. We find that those digital expectations are out there in the marketplace today, and they need to transform from the current state we have today.
John, and I know that probably most of our attendees are visualizing their own environments, and they probably are thinking of that phone in the care unit in an acute setting, or the phone terminal sitting on the central nursing station, or in an exam room that really never gets used. They're not at all thinking about a mobilized digital cloud-based model. When you take a look at the new era of digital patient and staff engagement, it truly is about secure, mobilized, in the cloud, highly visible, highly accessible teams, and great connectivity with patients. So let's take a look at what that new era really looks at when you look at some of the expectations of staff around how they want to collaborate.
Thanks, Lance. Yes, what we see as we move and work with clients across the country, understanding their needs, we see some very clear issues they want to have to help drive a shift in communications by design. So secure messaging, for example, everything high trust, HIPAA compliant tools are critical so that we can really deliver care, not just refer to URLs, refer to websites or portals. Being able to actually have content-rich data that goes across these mediums that allow care providers and patients to share information about the care process and really engage in a way that really drives care forward. One device, multiple capabilities, being able to consolidate tools and systems so that you don't have a panoply of applications. On the administration side, having tons of applications for different elements of communications is very complicated, where to have everything on one device and one management administrative tool is very powerful. Updating presence, as I said in earlier state, we want to be able to know and have both the administration know where the care team is and have them linked by design and know the awareness of their availability. So when we want to do a direct route, for example, of a patient in emergency to a doctor, you can make those decisions real time on the ground and really drive patient experience up through that process. Device flexibility, the ability to move across devices, whether it's a tablet, whether it's a workstation, whether it's a soft phone, whether it's your cell phone. All of those things are viable in this digital age, and those are the types of flexibility that we're seeing demanded by the next generation care teams. The ability to share documents and to share activities as well so that you have tasks and other things that can be shared across care teams. We see a real power in creating per patient collaboration groups where a patient going through a complex set of procedures, for example, in a care group, has all the specialists, all the care team, all the nurses and specialized nursing groups, nutrition, pharmacy, and others connected collectively so that they can all see that patient's history, activity, and then share and have a very collaborative environment around that patient care environment. So it's very powerful. Creating those defined teams is part of really understanding a way to create mobility as well, because with the tools, you now virtualize the access to the care team and really allow them to move across their physical facilities, their home, their work environments, and patients as well to do the same thing in a way that's very powerful. It creates a very powerful, I'd say, agile infrastructure going forward to help care teams re-engineer their workflows, but provide better care and better experience for the provider community as well.
John, it's so critical to tie all of these workflows together. I think many of them are done separately. I think some of it's done in the electronic health record environment, but there's such specific access to that environment that you don't truly have true team-wide collaboration occurring. And I think when the attendees think about the real breakthrough to streamlining healthcare operations, it really is about consolidating all of these capabilities into a singular device. But what is also critically important is the adoption requires easy deployment and support. And I really think that's the true breakthrough with cloud-based collaboration capabilities within a communication system. What else is important when our attendees are looking at some key capabilities, some key requirements around this cloud-based environment?
As we said earlier, right, just reiterating some of the points that were raised earlier, right, the advanced point of care efficiency, making sure the care providers and patients can get with each other very efficiently, ensuring that the care coordination team can work and the right specialists can be captured within an agile environment. And again, driving all that support and engagement on an ongoing basis, which includes an increase in many cases of communication through messaging tools and other things that help make the patient feel like the care team is more connected to them instead of a once every 6 months visit. There's an ongoing activity. This digital engagement allows a much more intimate relationship with the care provider ongoing with patients, particularly patients like chronic care patients. So beyond that, we see obviously you start to infuse some next generation technology. So for example, AI supported call routing, where you can really understand from the inbound patient call, monitoring that call, what the needs are, and then drive call routing accordingly, giving patients real-time self-service options. We talked about that Monday morning challenge when everybody's calling the office and there's a 30, 40-minute wait. We want to get rid of that. The next generation digital tools allow self-service. They're very retail-based in the sense of how they respond to customers at the need of when the customer wants to do it, where they want to do it, and whatever device they want to do it on in that place. Enterprise-wide security is key. As we move, we cannot change the security requirements for personal information, PHI in this case. So we want to make sure that across all of these mediums, we're seeing a HIPAA certified environment by design that's high trust. Obviously, RingCentral provides that through our certification process, and all the tools and all the mediums that we're talking about are there. So as you move to a next generation tool that's consolidating all these elements, you have a high trust environment across the board to answer and make sure your care activity occurs. Centralized administration, one of the things we're seeing in this next generation of digital tools is a much more powerful capture of data and history such that the analytics and ongoing administration of activity can be used as a new asset in care management. You now can take the activities you're doing through your communications environment, messaging, voice activity, video conferencing activity, collaboration activity, take all that data that's now recorded and look at that data in a new way, put analytics and next generation analytics on that, and look at things like care consistency and care quality through new lenses, really help enhance the way you deliver care as a provider. Fast user and site additions by design, the cloud has that flexibility. It helps you as we see aggregation and M&A occurring in healthcare. It's a very powerful asset to help. We talked about reporting and analytics. That analytics we talked about as well as real time. So those reports can be handled real time. You can interact real time within engagements with patients in a way that's very powerful. Including the messaging, as I said earlier, is kind of the next generation of kind of consistency and an increase in activity. A lot of outbound, inbound messaging now becomes part of the patient experience by design, and it's a much more coordinated activity, helps efficiency and helps scheduling for the doctors, helps the patient feel like they're really being provided for and cared for by design. Then finally, being able to look at a design of these workflows in a new way allows you to really think about re-engineering with these new tools the whole way you deliver care going forward. So the engagement tools are powerful across the board, and RingCentral's platform allows you to do that at every stage.
Yeah, John, so critical to our attendees. You know, acquisition is just a persistent state in healthcare. There's always ways to streamline services through acquisition and isolating specific specialties under a singular umbrella, and that's going to require consolidation and acquisition of different sites, the ability to scale a new communication collaboration system almost immediately and add users, finding out good workflows for how a particular practice wants calls to be directed and answered, and that works. So let's do it at 6 other locations, being able to repeat those call flow templates. And then finally, just as we mentioned, the burgeoning growth of voice-only telehealth, the reporting and analytics, you have to be able to capture, you know, based on the CPT code, it may be an 11-minute conversation. It may require a 20-minute conversation before it hits that threshold for reimbursement. Got to be able to have the metrics to back that up. So, John, these are all great capabilities that make the adoption easy and really drive towards the cloud. And let's talk about one example of a very, very large client that's done this as well. Just highlight a couple key takeaways from Chen Med.
A great client of RingCentral's down in the Southeast. Chen Med is obviously a large-scale clinic focusing a lot on senior care, 42 locations, over 1,300 employees. And what we found, Chen Med has been able to use the RingCentral platform across the board, from the contact center to the UCAS environment, to not only re-engage all their patients, capture calls they were losing in the past, and reorganize the way they manage call flow of inbound and outbound patient communications. But they also, during COVID, were able to distribute that team and activity across a distributed world very quickly and had no impact at all in terms of their staff and their staff's ability to service their patients as they were in the facilities as well as at home. And now that hybrid environment has been very powerful. And as well, one of the things they did is really use intelligently their patient histories tied to communication environments to allow them to really manage through the difficult time. For example, during COVID, they really reduced fatality of their senior people who they're managing in terms of care by being very proactive with messaging, outbound calling, ensuring that at-risk patients got all the information they needed moving forward. The goal was basically to drive a better relationship with patients and using the tools of MVP, contact center, and obviously a high trust certified environment everywhere, reworking their workflows. They were able to really change the way they did business and create a next generation care environment by design.
Thanks, John. And, speaking of building strong relationships with patients, another area when we look at the new era of digital patient engagement has to include the patient experience and specific capabilities to dramatically improve what that experience is like. So today, when we look at the current state of how most providers engage with patients, it's really built around a traditional model of heavy inbound calls that are going to manage from in-office scheduling to care questions all the way down to billing is generally very heavy on inbound. There's no intuitive outreach or outbound. There's no engagement around any call triage beyond maybe some minimal interactive voice response tools. Maybe there's a little bit of information shared on a website. Same thing with patient portals, but they're not integrated to any type of deeper collaboration channels. And it ultimately just ends up, probably being translated to a patient care representative for a response. So very much serial in, address, probably long wait times, no intuitive routing of calls, and very limited channels to engage. So going forward in the new era of digital patient engagement, it really is about adopting new digital capabilities. It's commonly referred to as a contact center. I like a patient engagement center because that's really what it's about. And from our experience, obviously a big, large acute setting's already in a state of needing a very sophisticated patient engagement center. If it's an ambulatory setting, once they've hit that third location, they're probably already prepared to address a patient engagement center just to have centralized patient scheduling. But the new era, what does it look like? It's about offering patients more intelligent digital self-service options. It's also about meeting them on their preferred channels. A good example of this is how effectively do providers really engage across social media? That is the patient taking their consumer experience to bear with providers. It's actually a great environment to engage with patients. How do you capture that sentiment across social channels if you don't have a new modern digital patient engagement environment for them to engage within? If they're on Facebook, can they immediately reach out to the provider and engage in a chat? Can they contact the provider in Facebook and use that channel? And how can they create a better patient experience through these diverse channels? Maybe scheduling can be done through self-directed patient selection versus a very transactional experience. What about refills and things of that nature? And then most importantly, the telehealth scheduling, that's where we really get into the more personalization of health delivery. And patients, they want to be known. They don't want to be treated as a new patient each time they call to schedule and go through all their care history, their insurance, and their background. That's all known information that can be captured in a new era of digital patient engagement. And most importantly, it's about making it all easy and simple for the patient. And a great example of where we've made it easy and simple is with Sun River Health. Again, much like Chen Med, this is a very, very large ambulatory environment that focuses on full care modalities and different specialties, 50 locations, 2,000 employees. And one of their key objectives was they had to improve their live answer rate. They really champion a live answer environment when that is necessary. And through sophisticated omnichannel routing using artificial intelligence, they know when it's time for a live answer versus a patient self-directed inquiry. And so you can see that they've dramatically improved their live answer rate. They were also able to rapidly shift to a hybrid work environment. They found that their staff that generally handle direct patient engagement can do that from a work from anywhere model, along by having the digital patient engagement technology. So a really, really great story here around Sun River Health and how they really improved the patient experience through their patient engagement center as well. And so that's been a really great look at the current state, where things need to go in terms of the new era of both unified communications in the cloud, but also contact center services in the cloud, and how that opens up greater collaboration for care teams and patients alike. So John, these are just, some of the benefits we covered with Sun River, is also with Chen Med, but what are some other key takeaways when our providers do shift to that new era of digital patient engagement?
Yeah, so to finalize and wrap up kind of our aggregate view of the market, we see real impact happening from the use and application of these digital environments in the care setting, right? Higher patient satisfaction scores, fewer and more efficient patient scheduling and less patient no-shows, much more powerful support to staff optimization, putting, as you heard in the Sun River example, the right staff at the right place, putting the right professionals, right profiles on hybrid or full-time schedules or remote schedules as needed. And finally, in the end, we're seeing better patient outcomes, better health, better care in general. So across the board, our numbers and our surveys of our clients are showing improvement across both the patient quality and the provider quality of life, and that's fantastic.
Thank you, John. And just to wrap up where our attendees can learn more, please visit ringcentral.com/providers. If you want to view more specific information about our telehealth capabilities, same URL address, just /telehealth. So John, it was great to meet with you and present to our attendees today. Let's go ahead and take some questions.
Thanks, Lance.
Yeah, to both of you, John and Lance, what a great presentation, awesome conversation. We have a ton of questions coming in already. I do want to get to those in just a moment, but before we jump in, I want to point out to you all on the screen right now, there's a poll asking you what additional information you would like to get about the RingCentral solution. So I know that you guys want more information because I can see those questions coming in. So right now, let RingCentral know how they can follow up with you, how they can support you, wherever you're at in this conversation, whatever information you need. It's an easy click, and they'll follow up and get you whatever you're looking for. And with that, I want to make sure we get into a few questions here. John, Lance, you guys ready to dive in?
Ready.
Ready and willing. Okay, or at least one of those is correct. All right, let's start with this one here because we do get a lot of questions about compliance. So I'm curious, how can we provide security and HIPAA compliance at scale with cloud-based tools? And then they're also asking RPM, virtual care, IoT.
Yeah, so we achieve that a couple of ways. So first and foremost, as a HIPAA-covered entity, our attendees would want to execute a business associate agreement with RingCentral. Any vendor that's going to have access or create or otherwise manage EPHI will need to do that. More thoroughly, though, what RingCentral does specifically is we go through what's called the HITRUST Common Security Framework audit annually. This is a third-party validation of the intense scrutiny and security levels of our cloud platform. And so this provides our customers with that peace of mind knowing that we've got the industry's best standard auditing and certifying our cloud environment for HITRUST Common Security Framework certification. And that by default naturally maps to all of the security and administrative controls of HIPAA as well. So always look for that gold standard when you're looking at any SaaS vendor to ensure they have that HITRUST CSF certification.
Super helpful. Okay. Now, for somebody out there, we have somebody kind of saying, hey, look, well, my administrators, their key focus is better performance and cost management. So with that individual's needs in mind, how would you say that a new cloud-based UC/CC infrastructure is providing that for her administrators?
Yeah, so really immediately when all of our healthcare customers switch from what is very traditional on-premise, very hardware-driven communications technology to the cloud, they're going to realize very, very significant cost savings. They're driving from a hardware-based model that has to be continually refreshed, managed directly, and they're shifting that cost to a always-on, always current software environment that's managed by RingCentral, and then the ease of use to be able to manage it from anywhere via the cloud. So that's just on the what I would consider to be more of a total cost of ownership side. Now, the real measurement that I think everyone should look at is return on investment. So when you're able to aggregate all of the various workflows, whether it be a nurse reaching a physician, whether it be a care team collaborating on a care pathway for a patient, when you're able to bring all those people into a singular platform with messaging, video, voice, document sharing, there's going to naturally be great economies of scale and great efficiencies. And so you're going to see a lot more clinical productivity. And all of our attendees know that if you can save just minutes here and there throughout a shift, it has a way of equating to tens of thousands of dollars in hard dollar payroll costs immediately. So there's that side of the return on investment as well. So yeah, and then just the displacement of all those disparate tools, you know, no need to have 4 different secure messaging platforms or 3 or 4 different video conferencing platforms, et cetera. Get it all consolidated on one platform.
Yeah, I love that, both ease and cost savings there. So I keep saying human hours, and cost saving in that answer. I do wish we could keep going because we have a lot of questions coming in. Unfortunately, we are a little short on time. So before you guys run away, I do want to make sure we get some information to anyone out there that's looking to get started, looking to jump in with RingCentral. So Lance and John, for that person out there who's excited to get going, what do they do? What's their first step?
Oh, easy. Just go to ringcentral.com/healthcare. And right on our healthcare page, you'll see an opportunity to click for more information, to schedule a demo, just get additional information. So easy 1-2 step.
Perfect. And you just got a high five from Venkat out there who wants to say he agrees with you on consolidation. So you're resonating with our audience out there. Thank you guys so much for coming to chat with us today and getting us some great information. It's been an absolute pleasure.
Great. Thank you so much.
All right. Well, and to all of you who took some time to answer that poll question, thank you as well. Anyone who submitted a question, I'm just going to remind you that we are going to get those questions over to RingCentral, so you will get some answers back, even if we didn't get to them just now in our live Q&A. If you are looking for more information right away, please do click into the Handouts tab, download that ebook from RingCentral, How a Cloud Communications Platform Puts Connection at the Center of Care. Super fun, interesting read. It's very engaging. Highly recommend downloading that now and be sure to check that out. Share it around after we wrap today. But don't go anywhere just yet, because up next we have another exciting presentation for you all. So our next fascinating innovator and presenter is Wayne Sachs, Vice President Solution Architecture at ClearData. Wayne, thank you so much for being here with us today. I know you have a lot of great information to cover, so the mic is all yours.
Well, thank you so much for having me. I truly appreciate it. So as you said, my name is Wayne Sachs. I'm the Vice President of Solutions Architecture here at ClearData, where we focus on protecting healthcare in the cloud. We are a 100% cloud-based consultancy, managed service provider, and security and compliance provider who works entirely with healthcare organizations supporting mission-critical clinical and research applications, really at the core protecting the security and compliance of those applications so that our customers can accelerate their journey to the cloud, make the most use of the advanced technologies that cloud service providers provide, and really ultimately support our mutual end customers, patients, and others who are seeking healthcare here and around the world. So one of the things that we have noticed in our time, about 10 years of working in the public cloud, is that healthcare is accelerating to to use the public cloud for a variety of reasons. But what we've seen some commonalities are that the cloud drives greater agility, it decreases costs, it gives our customers the ability to modernize their applications, it allows them to leverage AI, ML, analytics, and other features that would be hard to replicate if they were trying to do it on their own in their own data center. And ultimately, what they're trying to do is to modernize and revolutionize healthcare, right? They want to get to better health tech innovations. They want to leverage advanced analytics to drive to better patient outcomes. They want to leverage real-world evidence more quickly, more effectively, more efficiently. Our payers and providers need greater levels of interoperability. And ultimately, there are thousands of data centers that are expensive that ultimately our customers would like to get out of. And we all know that the cloud provides the ability to accomplish these goals. But unfortunately, our experience is that getting there safely with compliance is hard. And it's hard specifically for healthcare organizations who have PHI, personal health information, because the risk of an unintended disclosure of PHI is substantial, and the cost of that unintended exposure is high. And so what we know is that healthcare data, right, is targeted, it's valuable, it's vulnerable, and it's costly. And these facts make the promise of the cloud harder to realize for our customers than they would like. And so ClearData has developed over the course of about 10 years, like I said, the capacity to accelerate our customers' journeys to the cloud by operationalizing security and compliance so that our healthcare organizations and customers can focus on what they do, our health tech customers can focus on what they do, payers and providers on what they do, clinicians on what they do, and we can focus on what we do, which is the security and compliance and the ongoing management of our customers' cloud workloads. So the question that typically comes up is, why is moving to the public cloud so hard? And what about the healthcare organizations makes this unique? Well, moving to the public cloud requires regulatory expertise that is specific to the apparatus of the public cloud, right? So HIPAA, everybody has been living with HIPAA for quite some time. But just because something is HIPAA eligible, as a cloud provider might tell you, doesn't mean that it's HIPAA compliant, which means that you can't just use the cloud services as is. You have to do things in very specific ways in order to remain compliant. And that's doubly difficult because the cloud service providers are engines of creation, and they create thousands of changes per year. And so that to stay compliant is a difficult activity. And it becomes even harder when we're operating across multiple geographies or when we have multiple cloud vendors. The complexity scales in a nonlinear fashion. It gets even harder and harder as we go. Another thing that has slowed our customers down is that in order to move to the cloud, we need strong technical execution. Managing cloud infrastructure and particularly sensitive data is a high-risk activity, and you need multiple types of SMEs throughout the journey. You need strategy SMEs, cloud operations SMEs, compliance and security SMEs. And those people are hard to find and oftentimes harder to retain. Again, that's difficult to do with a single cloud, but then when we get into a multi-cloud scenario, that becomes even harder. And then finally, what makes it hard to move to the cloud is that there are solutions for elements of these problem sets. But unfortunately, those solutions tend to be fairly fragmented. And so for a customer, one of our customers, to leverage those solutions, they would have to stitch together 5, 10, 15, 20 different solutions in order to get a comprehensive outcome. And unfortunately, it's even harder because those solutions tend to be fairly agnostic as to the specific implementation. You know, they tend not to say you will or you must do these things. They say you could do this, you could do that, you might try a couple of different options. But the lack of opinionation means that a customer is required to become an expert across a variety of verticals and horizontals, when really what they need to do is be an expert in what they do specifically. And so those elements make it hard for healthcare organizations to effectively move to the public cloud. So what ClearData has done is we've created an organization, a product set, and a set of services that cover or provide solutions in an integrated, unified way to those three big problem areas. We have a product called the Managed Health Cloud, which is a set of tools and people, human beings, who help our customers operate their cloud infrastructures with a specific bent towards security and healthcare compliance, whether that's HIPAA or high trust, GDPR, et cetera. We have a product called the Cyber Health Platform, which is a software tool set that operationalizes the security and compliance of those cloud workloads. So our customers have the ability to see all of their cloud estate, look at the state, the compliance and security state of their cloud-based workloads, and even better, evaluate them against the relevant regulatory standards. And the product itself has a set of built-in safeguards that, when tripped, can automatically remediate those cloud workloads to push them back into compliance. And all of that is underpinned by what we call our policy as code engine. And that policy as code engine is really the secret sauce to making this whole thing work. And that is a translation engine that takes on one side the state of the public cloud infrastructure and the laws and regulations and court cases that are currently ongoing and happening all the time, and translates those items into a set of rules and remediations so that our products can look at the cloud configuration, identify what is in compliance or insecure, and can remediate as necessary. And all of that has led to some really incredible outcomes for our customers. So in the course of 30 days, we tend to remediate about 50,000 compliance, identified compliance failures. We remediate about 6,000 failures manually, because not everything can be done with automation. We stopped about 2,600 ransomware attacks in the last 90 days, almost 4 million Log4j attacks since December 21, 140,000 reconnaissance attempts thwarted in the last 90 days. Most important, and I'm knocking on wood when I say this, but no data breaches. And to imagine to do that type of remediation and prevention at scale without some sophisticated software that is built purposefully for this outcome is virtually impossible. And so our customers gain the benefit of the tooling, the process, and the people who are designed specifically to execute against this mission. So to talk a little bit more about what we've built, we built the policy as code engine as a tool to help our customers deal with the complexity of regulatory expertise. We built what we call the Managed Health Cloud as a tool to help our customers deal with the problem state of strong technical execution. And we built the Cyber Health Platform as a way to weave together the fragmented point solutions into a single unified pane of glass that stretches across the three clouds. And so for a customer, all they have to know is that they have access to these tools, these people, these processes, and they can make use of the cloud without having to need to be experts across the whole cloud environment. So that, like I said, the policy as code engine is in many ways, the magic behind the curtain. It continuously evaluates the regulatory and standards and risks across the environments, and on the other side, it produces procedural and technical controls. This is complex, detailed work that crosses the lines between law, compliance, regulation, and technology. We've got a team of individuals who focus on doing just this. And what they produce are the rules that the cloud configurations must follow in order for them to be secure and compliant. The cyber health platform the managed health cloud is our people and processes similar to a managed services organization that actually on a day-to-day basis ensures the security, compliance, uptime, and general health and well-being of the cloud estate for our customers. That includes cloud operations. That includes something that's called managed defense, which is a defense in depth organization, which gives all of those incredible outcomes that we talked about a few minutes ago. And then the cyber health platform is sort of the instantiation of the technical controls, and it gives you the compliance dashboards and the reports, identity access and management, remediations, doing things at scale which a human being really would not be able to do on their own. And then when we're talking about the cloud security and management, what we're really talking about is sort of 6 different things. So we're talking about managed defense, which is something that's sort of the unheralded champion of the organization, right? Because defense ultimately is best when it's invisible. We want our customers to know that they are secure and safe, and when everybody has forgotten that the managed defense organization exists, they've likely done their job really well. But what they do is they collect telemetry from across the cloud environments. They categorize it, organize it, identify threats, and neutralize those threats, oftentimes before our customers are aware that those threats even exist. We curate our own intel feeds, and with the set of customers that we have, when one customer experiences any sort of event, all of our customers are immediately fixed at the same time. So it's a powerful collective action enhancement. We also provide risk and compliance support. So when a customer has any sort of risk or compliance challenges, we work with them from initial design all the way through to final implementation, ensuring that their workloads are continuously compliant, that they start compliant, they stay compliant, and that we create automation that pushes their environments back into compliance when or if drift ever occurs. Our goal is to make it pretty hard to find yourself out of compliance. And there are sometimes reasons why an environment needs to have a configuration one way or another that might on its face look like it might not be compliant, but our engineers and our security staff work to create mitigating factors and other techniques in order to ensure that at the end of the day, our patient data is secure, our patients' records are secure, and that they won't get out accidentally or with a bad actor. We also leverage a tremendous amount of automation, leveraging DevSecOps in order to do this at a scale that most customers would find difficult, if not impossible, to do, which leads us to 24/7, 365 days, full service support, SMEs, full-fledged ticketing infrastructure, 24/7 phone lines, and all of the things that you'd expect out of a modern day, high-performing service provider. And on top of the security and compliance bent, we also really offer deep levels of infrastructure management and cloud optimization. Because at the end of the day, these workloads, they not only need to be secure and compliant in order for them to be useful to our patients, but they need to be operational, they need to work, and they need to be cost optimized so that everybody is getting the most value out of their organizational dollar. The cyber health platform is really the wrapper around a set of technical tools that help our customers operate at scale and safely. So that includes some elements like the automated safeguards, which evaluate constantly your cloud estate and push it back into compliance if a trigger is tripped. A set of documents that we call compliance reference architectures. And this is another one of those innocuous sounding terms that really is of tremendous value to our customers. So ClearData engineers, security and compliance experts evaluate every single HIPAA eligible service and do a deep dive on its security and compliance posture, looking at all of the available configuration settings, and come with an opinionation on exactly how a cloud service needs to be deployed and managed in order for it to be compliant with a relevant regulatory standard, whether that's HIPAA, GDPR, etc. It's a lot of work, and it requires a combination of a bunch of different skills that most organizations don't have, and if they do, those folks are in high demand. And this is just done on our customers' behalf. We have a really deep reporting infrastructure, which are audit-ready reports. So our customers find the amount of time that it takes for them to get through an audit is dramatically reduced. And we can show trending and historical data, so you can show an auditor that you not only are compliant today, but you've been compliant for the whole year. And we can intersperse that with risk, so that your operations folks can look at where data lives and what the relevant risk is for that data based on its compliance and security stance. And you can look at your IAM, your identities, across the cloud estate, so that you get a sense of what access rights are given to places that have what types of data. So it's a sort of a combination of tools and techniques that give you pinpoint accuracy for what you need to care about the most, what needs to be secure, what needs to be focused on, and help you manage your risk and stay compliant and secure. And of course, you know, what it all comes down to is that it's also quantifiable for our customers who have to make this decision to work with us, that this is worth their time and their effort. So, you know, we come to the market with a flexible set of terms to fit our customers' needs, with a consumption-based pricing model, so that as you use the cloud, our pricing model scales with your usage. We also take a lot of pride in the fact that we can help our customers save a fair amount of money. We think it's about $1.6 million in cost reduction for a mid-sized customer by reducing the need for full-time employees who are oftentimes already used for other high-priority mission-critical items, and reduce the need for 3 to 5 security and CSPM tools, so that you don't have to worry about the creation, the maintenance, the upkeep, the tools, monitoring and maintenance, and just focus on delivering patient outcomes. And for our health tech customers, we see our customers on average get to market 3, 4, 5 months faster per application that they're trying to bring to market, which can be a tremendous cost savings if they're racing to get to market to deliver outcomes to their customers. And ultimately, right, the risk of reportable incidents is dramatically reduced, and that is a priceless saving. So the question, you know, that we hope to answer is, why ClearData? Well, we protect healthcare in the cloud. We are healthcare's largest managed cloud and security provider. We have deep cloud security and compliance expertise, and proprietary technology that protects sensitive data day in and day out for hundreds of customers across all of the different clouds. So if you'd like to learn more, please contact us at www.cleardata.com, consultation. And with that, I would love to answer some questions.
Yeah, absolutely. Wayne, thank you so much for such an interesting presentation. We got a lot of great questions coming in, and I do want to get to those. But first, I do just want to point out that we put up that poll for you all. So again, let us know what additional information you would like to get about the ClearData solution. I've said this before, so you've heard me say this, but again, it is not always easy to know what information you need in order to get started. Let ClearData make it easy for you. Tell them exactly what they can hand you for wherever you're at in this decision-making process and learning process as well. So click on the poll, let them know what information you would like to get from ClearData so that they can follow up with you effectively. And while we've got Wayne here, let's jump into some questions. You ready to rock?
Absolutely.
Okay, locked and loaded. All right. Well, a question from Nathan here to start us out. So he's wondering if the platform is fully self-managed or could it be managed for him?
The platform, it actually can go either direction. So some of our customers really want to do no management at all, and we're happy to work with customers who are in that position. We also have customers who want to do most of the work themselves and want us to do some things for them. And we're also happy to provide support in that direction. And there's a blend all the way in between those two poles. Ultimately, we have the ability to meet our customers where they are. So we try very hard not to force customers into, a pattern that's not comfortable to them.
Perfect. Yes, it's got to work for you and your organization. Well, speaking of which, another question here is CyberHealth going to work with SIM solutions? In other words, would CyberHealth work alongside SIM to distinguish what is and is not a security concern?
Yeah, absolutely. So we have a SIM and a SOAR that our managed defense organization uses on a daily basis in order to support our customers' security workloads and security needs. We also have the ability to, ship sets of data to our customer SIM and help them make some sense of that data that's flowing their direction. So some of our customers don't want that because they just want the managed defense organizations to take care of everything for them, and others want to have a little more deeper enriched data. Again, we will meet our customers where they are rather than forcing our customers to come to us.
Perfect. Well, on that note, does CyberHealth protect cloud backup data as well?
Yeah, absolutely. So we can do this in a couple different ways, but by default, in order to be compliant, cloud backups need to be treated in certain types. Backups generally need to be treated in certain types of ways. So that's a level of protection. We have customers who have increased protection requirements for any number of different business reasons, and we can support whatever those requirements are, whether that's an offline vault. We can support working through that kind of a request, although it's extraordinarily unusual. We can set up immutable repositories, which is not that uncommon for our customers. Really, it depends on what the business requirements are that our customers need, but we're happy to support it. One of the things I think that we have a lot of value to customers that is unusual for this market is our exclusion to healthcare means that we have a really deep sense of what healthcare organizations need and what other healthcare organizations are doing. So it's not that unusual for a customer to say, hey, I've got this need, but I'm not entirely sure how best to fulfill it. And we can say, with knowing 10 or 15 or 20 other organizations really similar to you, most of them choose to do X, Y, and Z. And here are some ways to decide what they've thought about when they were making those decisions. So we can help get to good answers a little quicker than many others.
Well, I love that. I wish we could keep going, Wayne, because there's still a lot of great questions coming in, but we are going to have to wrap it up there. Last thing for you, if somebody's ready to jump in, they want to get started with ClearData, what's their first step? What do you suggest?
Just go to www.cleardata.com. You can click on the button to say, get in contact with me. Like the last speaker, it's super easy and quick, and we will be happy to get in touch and help in any way we can.
Love that. Okay, well, thank you again so much for joining us here today. It's been an absolute pleasure chatting with you.
Thank you so much.
And thank you to everyone who filled out the poll. Great to see those answers coming in. And I do want to remind you that if you asked a question that we didn't get to during the live chat, we will make sure that that gets to Clear Data and to Wayne, so you will get some answers back on that. So thank you to everyone who's asking some great questions today. I also want to remind you to head on over to that handout tab, and you can find the definitive checklist for healthcare cloud optimization from Clear Data. Such a helpful read, so many great takeaways. So please do click on that handout, download that, save that for later. I promise you're going to want that. And while you're doing that, I'm going to go ahead and move us along, because some of you, I'm sure, are wondering when we're going to get to our next prize giveaway, and the answer is right now in this second. So we have a $500 Amazon gift card. A quick reminder that you must be present at the webinar in order to win. And our next lucky winner here with us today is Amanda Nash. Amanda Nash of North Carolina, you have won a $500 Amazon gift card. We will follow up with you after we wrap today. And there's still one more gift card plus another chance to win at Best Question Asked. So be sure to get your fingers all limbered up, get that keyboard ready, and get ready to ask some great questions up next, because we have another absolutely fascinating presentation. I don't know how this always happens so quickly, but we are here at our very last session of the day. Luckily, we are definitely wrapping up with a bang. I am so excited to introduce you all to Catherine Valadores, Vice President of Enterprise Solutions at Nextiva. Catherine, thank you so much for being here as our grand finale on the EcoCast today. I'm going to hand the mic on over to you.
Thank you so much. So ladies and gentlemen, thank you so much for joining and for taking the time to stick around for the last session. But I'm super excited to talk to you about Nextiva today and to really get into the nitty-gritty of what we're finding in the healthcare space in terms of where we can assist in providing a better customer journey. But before I kind of get into the customer journey discussion, I do want to give you a high-level understanding of who Nextiva is. So we are the largest privately held communication provider in North America. What do we provide? We provide everything from your basic SIP trunks to unified communications as a service, to call center practices, to contact center. And what I'm probably going to spend the majority of my time talking about today is the idea of virtual agency. And so leveraging technology, AI, artificial intelligence to really power the customer journey, meet your customers where they are, and to give them the experience that they tend to be seeking. Before I get there, Nextiva is, as I mentioned, the largest privately held, but we also have 100,000 plus customers. We process billions and billions of conversations, whether those be in voice, text, email, chat, on a yearly basis. But we also provide HIPAA compliant services under a BAA for all of the services that we provide. So rest assured, we definitely understand that compliance is of top mind to all of our healthcare customers, and we definitely provide the services that are needed there. What I really want to focus on today is what we're seeing in the industry. So we're seeing a lot of challenges to healthcare providers when it comes to our new norm, right? So the post-COVID, if you will, on workforce shortages. Everybody here has heard of the Great Resignation. I think the newest, latest, and greatest of that is what people are tagging quiet quitting. But we're definitely seeing that there is a gap in the ability to fulfill staffing, also the ability to even just interact with customers for very mundane tasks like verifying their insurance and or verifying the needs that they have and matchmaking them with the correct physician. We're also finding that patient loyalty is at a low time, simply because people are making changes due to their new requirements. So a lot of things is telemedicine. So again, not going into a brick and mortar location and being able to get health advice from your home, from your cell phone. So because of that, the historical loyalties that we had to our healthcare providers are going a little bit to the wayside. In addition, there's a lot of financial uncertainty, not just with our consumer base, but in the business world as well. We are definitely in uncertain times on whether or not there is a profitability in what we're doing, and so there's lots of cuts going on, and those are making an impact as well. Most of you have probably already made the migration to the cloud, especially considering the new climate that we're in and some of the things that I'd mentioned, but that can be a daunting task, especially when it comes to communication. And what I'll say about moving to the cloud is that we're not just looking at voice as a service any longer. We're really looking at that omni-channel, multi-channel experience. Customers want to interact with us by any means necessary. They want us to be accessible 24/7, 365. And again, they want to leverage whatever tool they feel comfortable with. So a lot of them are looking at text messaging as a way to communicate with their healthcare providers. They may be looking at chat on a website so they can keep themselves behind the desktop, if you will, and not have to interact with humans so much. So we're looking at a way to solve for every single one of these items. In terms of workforce shortages, there's some stats on my slides that I'm not going to necessarily read for you, but we're looking at there being a significant gap. And so customers or individuals like yourselves are really finding it hard to really fill those spots. As I mentioned, we're seeing the switch in the healthcare providers, and of course, there's a lot of concern in regards to revenue losses and revenue gains. So we're going to talk about solutions that can solve for each one of those things. We want to really improve your operational outcomes and gain that customer loyalty by some of the solutions that I'm going to discuss. So when we look at workforce shortages, enabling people to work from home is probably one of the biggest drivers at this point in time in terms of the changes that we're making to our communication solutions. So again, offering that omni-channel engagement, but also allowing our workforce to work from anywhere. And that includes myself, who happens to be doing this presentation from a hotel room, simply because I travel consistently. And so this gives me the opportunity to communicate with all of you. But as healthcare providers, it also gives you the ability to provide services from anywhere. Another way that we can really augment the workforce shortages is by leveraging that virtual agency that I talked about earlier. So giving customers the ability to interact with bot technology to gain information. So whether that's your hours of operation, where you're located, what insurance you accept, what services you provide, all the way down to nitty-gritty information like test results and or what do I need to prepare for the procedure that I'm going to have? What do I need to bring with me to the hospital for the surgery that I'm having? And again, using bot technologies is 100% HIPAA compliant. So we do have the ability to provide that detail to your customer base without leveraging humans, which could obviously enforce or reinforce the workforce shortages that you're having by leveraging those tools. In addition to that, we can set up automated workflows. So again, when a new patient is coming into your environment, verifying their insurance, verifying that they have coverage, setting them up for success in terms of what their payment is going to be for the services. And then, of course, going all the way through to making that payment. And that's the best thing about virtual agents. They're available 24/7, 365. They do not get sick. They do not call in. They do not take PTO. And again, consumers are really looking for that ability to have those interactions 24/7, 365. So if they need to make that payment at 2 o'clock in the morning, because that's the only time they're available, we can give them that particular functionality within our systems. In regards to improving that patient loyalty, it's again, meeting customers where they are. So I'm sure I actually just heard the previous presenter say that same exact tagline, but the consumer base has changed. A lot of individuals, including myself, prefer to interact via text message. That gives me the ability to track the communication, to actually have a transcription or writing of everything that I've done with whoever I'm doing business with. It also gives me the ability to be proactive. So again, think about things like sending out messages to patients on flu vaccines or other things that are coming about that you're willing to offer to the consumer base, even at a discounted rate or via a specific insurance carrier, et cetera. It also gives you the ability to kind of streamline that experience. So again, if a consumer wants to use text messaging with you primarily, that can carry through not just to their registration and their ability to verify that they can leverage your services, but then again, getting their test results, being able to get their balance due, to be able to make payments to you, in addition to get referrals to other physicians for specialty services and things of that nature. But we can keep that as a streamlined experience for them in text messaging as an example. It also gives you a lot of power regarding the data that you receive on all of these transactions, because you can start to really analyze your business on how do our patients want to do business with us today? Where should we be making investments on how they can have abilities to communicate, what information they have access to, et cetera. And so data becomes super important in this new world, if you will, on bringing in additional modes of communication, as well as leveraging that automation that I've been speaking about. Then there's the whole idea of financial uncertainty. So the ability to move away from a brick and mortar kind of gave us a lot of control in terms of the expansion that we have and access to patients that we can interact with. But that also gives us our own financial security, because we can control the way that we interact and the spend that we have and the cost that we're using on communicating with our patients by leveraging all of these additional tools. So for example, I don't want to be paying a six-figured employee to be making appointments, changing appointments, verifying insurance, et cetera. I'd much rather use technology to do those things, because, again, that's a cost control for myself. As mentioned, because they don't call in and they don't get sick and they don't take PTO, it also gives me the flexibility to really leverage those services for the financial gain as well. In addition, we all have the obligation for being compliant, and as I've mentioned several times, these tools will allow you to stay compliant. It'll also allow you, again, to interact with these consumers 24/7. So if, again, their only ability is to make payment at 2 o'clock in the morning, you have the ability to do that or offer that to them. So let me talk a little bit about how a virtual agent can really improve your customer journey. And just to give you an idea of what a virtual agent is, because I've mentioned it several times, most of the people on the phone today have interacted with Siri or Google or Alexa. And truth be told, that's your personal virtual agent. So conceptually, put that into your particular environment and think of ways that you could offer that level of service to your patient base using those similar tools. So I had mentioned appointment reminders. That's a big one. Whether that's via text or that's via voice, it's really just confirming that your patients will be coming to the appointment so that you're not wasting physicians' time. In addition to the appointment reminders, you can also do outbound campaigning on the next appointment. So you just received X procedure. In 6 months, we need a follow-up. So the system has the ability to track that, and in 5.5 months from that date, send proactive communication to that patient saying, hey, you really need a follow-up and it's due in the next 30 days. We'd be happy to assist in actually creating that appointment or setting that appointment. Pre-authorization is huge. I hear physicians all the time complaining, again, that they have nursing staff that are actually qualifying whether or not the patient can leverage their services, whether insurance is covered, whether or not there's payment plans. And all of those things could be augmented by a virtual agent so that you can actually leverage the intelligent staff that you are paying high dollar for to do what you're paying them to do versus some of these mundane tasks. Another big one is FAQs. Most people that interact with their physicians or with their healthcare providers have a lot of questions. They want to know what the procedure is going to be. Am I supposed to not eat 12 hours before? Should I be bringing something with me? Do you need more information from my insurance company that I can provide to you? So FAQs is another way to leverage virtual agents for that excellent customer journey so that they can get that information at the fingertips in an immediate response. Another big one is prescription refills. A lot of people are, again, wasting human time validating that they are eligible for the refill, that refill gets to their pharmacy, that it's going to be available when they show up. And again, those are things that we can augment or automate so that you do have the ability to offer those services. And then lastly, I really want to talk about surveys. So as we move into this new generation and this new climate that we're in, it's important that we gain information on the patient journey. How do they feel about the things that we're doing with them and the actions that we're taking? And so surveys is a powerful way to do that. It gives them the ability to remain anonymous or named if they prefer, but it also gives you honest feedback on ways that you can improve the services that you're providing to your own customer base. So my big, announcement here is that virtual agents have the ability to provide and augment onto every healthcare concern that we're seeing coming out of our healthcare base today. So I want to give you an example of where we made a significant impact with one of our customers in regards to their experience. So we have a very large organization in Northern California that has services available to vets. And during COVID, they had a very hard time communicating with their consumer base on changes to procedures. They had several outbreaks and they needed to notify family members that there was no visitation. They also had to go through a slew of questionnaires on what needs to happen before you can actually come on site and interact with us. And they had no way of doing it, but they really had this need to be done very, very rapidly. And so the cool thing, or the cool story here, is that we were able to spin up virtual agents in less than 4 hours. We were able to text blast and communicate with the family members of all of the residents in this environment in less than 4 hours, and that was over 100,000 recipients of the information, letting them know the changes in procedure, the inability to visit their family members, and then also give them a way to interact to find out additional information should they want to follow up and or really research what's happening with their family members. As you can imagine, that was the initial use case that we were solving for them, and then it just continued to multiply, because the cool thing about virtual agents is once you've figured out a way that they can fit into your business, you continually find more ways. And so for this customer in particular, not only did we power the external communication, but then they also had some crippling effects on the internal side. And so what I mean by that is the staffing requirements changed. As you guys can remember, during the COVID times, there was a slew of questions that had to be asked. Have you been in contact? Do you have a fever? Have you tested positive? And so they had no way of really allowing their staff to interact with them in an immediate way to be able to keep staffing on site and keep their residents safe. So they ended up leveraging the virtual agents for that. They set up a hotline where all of their staff members could call in. Again, as I mentioned, this is data rich, so every single one of those responses was captured, and so for compliance purposes, they were able to provide that to the government entities, if you will, to say, yes, we have checked that all of our employees are safe and they do have the ability to return to work, and we do have staffing coverage. So that's just another way that they leverage it. And then, as you can imagine, they realized how impactful that was, and they're in an environment where their staff may go from one location to another and or shift where they're providing services. And so they ended up leveraging the virtual agency for staffing purposes. And so not only do they have the ability for clearance for their own internal staff, but now they have shift bidding, and they have the ability to change locations on their staff to be able to show up at a different site where they might not be expecting it. And they've really leveraged this powerful tool to create an environment where not only are their external consumers or the patients and the patients' families very, very pleased with the amount of communication that's happening and the way that they're completely aware of everything that's happening with their loved ones, but they've also really learned how to operationalize internally. And so they don't have gaps in staffing. They don't have duplications of efforts because multiple people are showing up for the same shift. They don't have the panic state, if you will, of dialing out and trying to get someone to cover a shift because they've literally leveraged the technology to do all of those things for them. And so this is a customer that has really, really leveraged the power of virtual agency to change their culture, to change the way that their consumers interact with them, and more importantly, to change the security that the loved ones of those that are leveraging their services interact with them as well. There are several different use cases we could discuss in the healthcare, but I wanted to bring one that again, really leveraged it from a basic functionality and then blew it out of the water and now has become almost 100% a virtual agency in terms of how they interact. And again, it's all instant, so the communication doesn't have a lag, if you will, and those people are updated in real time, which is very important in a healthcare situation. So when it comes to Nextiva, we have lots of different success stories. I have some of them listed on my screen. I will give you just one more quick use case in the behavioral health. We've set up virtual agents to do what I call matchmaking. So we've put into a system where a consumer can call in and they can give their requirements. So I'm looking for behavioral health for a teenager who's a troubled teenager, who is dually diagnosed, who requires a female practitioner. And by leveraging the tools, they have, again, this matchmaking. So instead of a human trying to figure out who's the appropriate practitioner for this particular patient, they're leveraging the technology to do so. And then, of course, empowering those individuals to create those relationships due to the fact that they've kind of done the behind research for their own patient base. But obviously, if you want more information on what Nextiva is doing, not just with virtual agency, but again, across the stack from SIP trunking all the way up, we would be happy to answer any questions that you might have. You'll notice that on my slide, there's just a simple email address, so I'm not going to direct you to a website. I'm not going to have you navigate through landing pages. If you are interested and you want to hear more information or you want to discuss possible use cases that your particular organization could benefit from, simply send an email to enterprise@nextiva.com. We have a team that's behind that particular distribution, and we have a 1-hour SLA. So somebody will be back in touch with you almost immediately. And on that, I want to thank everyone for their time.
Oh, thank you so much, Catherine. What an interesting presentation. Absolutely a great way to bring us home today. Some really great examples and use cases. Just, yeah, fascinating from start to finish. So we have a lot of great questions coming in. I want to get to those in just a moment. But first, and I'm leaving your links up a little bit longer. If you haven't had a chance, click on those links, get those open, save those for later. But I'm going to move us over to our poll now. And again, one last time, we want to know what additional information you would like to get about the Nextiva solution. And a reminder that this is, again, a way to reach out directly to the Nextiva team. So you are letting Catherine and the team know what additional information you would like to get, what is most helpful to you right now. So you don't have to waste any time digging around for the right information. They're going to put it right in your hands. So click there, let them know what information you would like to get. And that feedback is very valuable to us. So make sure that you take some time for that. Well, Catherine, thank you again so much for being here on your travels, for joining us from a hotel room. You ready to jump into some questions?
Absolutely.
Perfect. Okay. Well, I'm wondering here, this question from Douglas, if you can expand a little bit on some of the benefits of using the virtual phone system.
Yeah, so I've mentioned several of them, but I think the biggest gain is that you're not restricted to office hours. As we've learned, the consumer base is really looking to interact with you, again, at all means necessary. And for somebody like myself, good, bad, or indifferent, I work about 18 hours a day. So if I can't interact with you late at night or on the weekends, I'm probably not going to do business with you, or I'm not going to leverage you as a provider. So it's really opening up the ability for that 24/7 interaction so that patients don't have to work on your time, they can work on their time, if that makes sense.
Yeah, it absolutely does. And I'm thinking that your experience might even, I think people worry a lot about not communicating with a human, but sometimes when you're getting those humans at 4 a.m. and they've worked an 18-hour day, you're not getting the best experience with them either. So this way you can ensure that the team's not burning out and get answers when you need it. Well, on that note, how do you ensure compliance with agents?
That's a really good question. So there are different mechanisms that are brought into our tools to make sure that we remain compliant. So there's things like call recording that is either disabled or paused anytime that you're discussing certain information. There's also guides that are provided in our GUI interface on things that you shouldn't ask, things that you should ask. Again, we can't 100% ensure that humans are perfect. Matter of fact, they're not perfect. But
shocking.
in our tools and our systems, we can definitely add visual cues and even audible cues to keep them on track. But this is another reason why I think there's a big importance on leveraging the virtual side of things, because as I've mentioned, virtual agents are 100% compliant. And the reason that is that they don't ingest that information. They don't share that information with others. They don't sit at the dinner table and tell their husband about the interaction that they had regarding some of these test results. So if you want to remain 100% compliant, virtual agents is the way to go, but we do also offer tools to others. In regards to the technology itself, obviously there's a level of encryption that's provided to keep it compliant, and then storage comes into play to remain compliant. But again, Nextiva does offer a BAA on all of our services, which is kind of the blanket to your protection to make sure that you stay compliant.
All right. Well, in thinking about the agents versus virtual agents, we did get a question here, and it's kind of two parts. So, one is looking at the training time that's going to go into training an agent versus training a virtual agent, and then the cost of a virtual agent compared to a human.
That's a really good question, and it's a long one. So it actually takes about twice as long to train a human as it does to train a virtual agent. So again, virtual agents are extremely smart simply because they have the ability to leverage every word, every text, if you will, to train them. So they learn based on their interactions, whereas humans have kind of a precept to learning before they actually get into a real life scenario, and then more learning after that. So we've kind of calculated it down to about 50% of the time is taken to train a virtual versus a human. And then when it comes to cost, it's even more drastic. So a virtual agent costs about 10% of the cost of a human agent. And again, human agents get sick. They sometimes are in a bad mood, and all of those things impact their interactions with your patients, whereas that doesn't happen in a virtual agency. And again, it's about 1/10 of the cost.
Yeah, that's a really good point to take into account too when you're considering those costs. Well, and I wish we could keep going because we do have a lot of great questions coming in. We are going to make sure that all of those go to the Nextiva team. But Catherine, before you leave us, for somebody that is really excited to get started and wants a little bit more information, you gave us a few answers right there at the end. What's the first step that you would recommend?
Send an email to enterprise@nextiva.com.
Quick and easy. I tell you what, I'll last chance to click on the poll. If you haven't already, click on the poll because I'm going to go back to Catherine's slide here. So there you go. There's the email address. So click copy, make sure you've got that down, take a screenshot, and make sure that you shoot them a message to get started. Catherine, thank you so much for being here to chat with us today. It's been an absolute pleasure.
Thanks for having us.
And if you are looking for more information right away, do make sure you head on over to that handout tab, click and download Nextiva for Healthcare, Improved Care Through Connected Communications. I love that. That's a good tongue twister. Improved Care Through Connected Communications. Interesting, really easy to follow information. So download that and save that for later. All right, and I think moving right along, I know what you guys are all waiting for.
All right, well, let's get to our last prize giveaway. Now, a quick reminder one more time that you must be present at the webinar today, right now, in this moment, in order to win. And our very last winner of a $500 Amazon gift card today is Jerry Demari of Texas. Jerry Demari of Texas. Congratulations to Jerry on your gift card, and congrats to all our winners today who have each won a $500 Amazon gift card. So that was Lynn Ma of California, Jean Malone of Massachusetts, Amanda Nash of North Carolina, and Jerry Demari of Texas. We are going to be in touch with all of you about claiming your prizes after the webinar wraps today, and a reminder that we will also review all the questions asked after we wrap, and we will follow up with the winners of the best question asked from each of our sessions. So that $50 Amazon gift card could be coming your way. All right. Well, hey, if you're out there on the EcoCast today and you're having a great time and you think that you might want to get involved, come have a conversation and present here on a future summit, an EcoCast, a megacast, a webinar. We would absolutely love to hear from you. So reach on out via email at connect@actualtechmedia.com. And with that, On behalf of the Actual Tech Media team, I want to thank all of our speakers today from Progress Software, Zerto, Sophos, Rubrik, RingCentral, ClearData, and Nextiva for making this EcoCast possible. A very special thank you to all of you for attending, for asking some great questions today, for answering those polls, joining in the discussion. I had so much fun with all of you today, talking about how to assess the tools in your healthcare IT tool chest. We covered a lot of information. We had some great discussions. We learned about all kinds of cool new solutions. So after all that, I know that you will all be taking away some interesting and helpful tips. I hope, honestly, that you are just charged up and excited to start tackling these updates, enhancements, and innovations within your own organization. And hey, before you take off today, be sure to mark your calendars and come back and join us again on Thursday this week for AWS Day, exploring the AWS support enablement and extension ecosystem. This megacast kicks off at 12 p.m. Eastern, 9 a.m. Pacific. That's Thursday. That's this coming up Thursday, September the 22nd. So I hope that I will see you all again soon. And until then, have an absolutely beautiful rest of your day.